pervasive smell now.
Everywhere that you find.
What clause?
Smell though, yeah.
I'm not sure that would apply, but maybe the city council will be willing to do that, but we'll look at it.
So what, there's,
They didn't impose it, they would just bring in. What's it
yeah,
called?
we're probably going to have a lot of the
There
renters
may be an
there.
opportunity
What
for,
are the,
rent.
I know the chocolate folks are coming Thursday.
For the, yeah, the advisory board.
I think
Thank
maybe
you.
arguably that might be appropriate, but I'll take a look at it.
I would rather them pay their employees and stay open.
Well, yeah, we're going to have that.
Paying us rent. I can't comment.
That's fine. We may have to consider all of the businesses there and bring it to the CRA. I have to.
Hear our response. Let's see.
Yeah, I don't know what to make, you know. Okay. Okay.
I got an email from a client at 12:45 last night wanting me to respond ASAP.
Morning.
Oh, Mikhail? Is this a revision from what was originally in our packet?
I'm going to just do the organization.
Morning. Okay. How you doing? Good to see you.
Good morning.
Not like we have a big audience.
Day after yesterday. Right. 17th. How could you forget St. Patrick's Day?
It was easy.
Did he actually sign?
All right.
Growing up in Atlanta, I do. That's all it definitely.
Oh, I'm supposed to be at city council. Good.
Break. I do. He can do play for somebody.
Thank you. Morning. How you doing?
Because me and the not wait ever bet.
Thank you. Pause. Yes.
He still wants to win another Super Bowl.
Yeah.
He's not gonna do it with Tampa Bay.
Well, he should have, wasn't gonna do it.
That's funny.
But he wasn't doing it. Oh, do you want it back? Yeah.
This one?
Hey, Mikhail?
All right.
Mikhail?
Thank you.
Sorry, we were talking about.
18?
So at this point,
Yes.
it's 8:58, and I
Thank
typically
you.
remind people to please silence all devices. I know we do not have a large crowd here today, but if you would just please check and make sure your devices are silenced. Thank you.
I am.
It's warm in here too.
Yep.
Why?
I don't have my email on my phone. Because it's like 40%.
Thank you for doing a good job from CDC Travel. How nice is that?
Very nice, you know, the frame.
I know. Get me free food.
You know, when you when you take away staff, we only have,
He's not in the room.
five? When you take away staff, we only have 5 people? That whole back row is staff.
I had some people comment that they were thinking about coming today, and I said,
I wouldn't be here if I didn't have to be.
me either.
5 people. So we did fine. We did fine.
I can't tell people not to come and opine.
I've been telling people to watch it on
Yep.
YouTube.
Absolutely.
Do you like our display here?
I like it. It's necessary.
Some of these people
Good morning. Welcome to the March 18th, 2020 Punta Gorda City Council meeting. Let the record reflect that all city council members and city officials are present. We'll begin by standing for the invocation, followed by the Pledge of Allegiance.
As a nation turns away from fear and to God, Isaiah says, "Do not be afraid. I am your righteous God who is with you." When the United States American Continental Congress convened in Philadelphia in 1774, the very first chaplain led them in prayer. Here is his prayer. Be thou present, O God of wisdom, and direct the counsel of this honorable assembly. Enable them to settle things on their best and surest foundation, that order, harmony, and peace may effectually restored, and truth and justice, religion and respect prevail and flourish amongst the people. Today, Father, we ask for your continued guidance for these city officials. May wisdom be the force that assists them in each and every decision. We also ask for your peace to return to the hearts of each individual. May your strength be supreme as we journey through this viral attack. Remember us and the power of your providence over all of life as your peace rules again. In Jesus' name, amen.
Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Well, good morning, and to those of you that are watching us on TV, I'm sure that there are many of you today because we have a lot of open seats here in the council chambers, but that's a good thing. And I know for myself, if I cough, I have just ongoing respiratory issues from my pneumonia 5 years ago, so don't be alarmed. And so, anyway. So on our agenda today, we have two proclamations, both of which have been withdrawn because the events have been canceled. So we will begin with a presentation of a 15-year service award to somebody that is an extremely important person in this, to our city staff and to all of us. So Howard, I'll turn it over to you.
So we do. We have a 15-year service award for Mikhail Finkel. So why don't you come up, grab the award, and then I'll say a few words. Well, here you go. We're not supposed to shake hands, I guess, but here, take a picture. Got to get a picture. Take a picture. So Mikhail started actually over in the city clerk's office, and then came over to the city manager's office, and as a paralegal and as the executive assistant, and has now sort of transformed into the paralegal and the assistant to the city manager. Mikhail has a number of people she works with, not just the city manager and the communications manager, but she works for every single council member, works for the city attorney, and wears so many hats that one person normally doesn't do all that work, but we are kind of lean here in the city. A lot of the legal documents go through Mikhail first before they get to our city attorney. And there's not a staff person in this room or elsewhere in the city who has not come in contact with assistance from Mikhail. And her young daughter probably couldn't come today because of what's going on. So, Mikhail, I know she doesn't want to say a few words. She doesn't want to say anything, but 15 years, she'll be here for a while longer, believe me. Thank you for everything.
And congratulations, Mikhail. Well deserved. The next item on our agenda is a presentation from the Florida Department of Health, a COVID-19 update.
This is Dr. Joe Pepe. Actually, Joe and I go back a long way. Many years.
Yes, sir. I think it's over 20 now.
Yeah.
Yeah?
Yeah.
So how's
Yeah,
this?
we knew each other from Cape Coral.
Oh, okay.
Yeah, my higher ed days. Just for clarity, I'm not a physician. I have a doctorate degree, I just am not a physician, so I want to make sure it's clear I'm not giving medical advice. So, thank you for the opportunity to present, and Madam Chair, with some liberty, I'd like to kind of bounce around in and out of my presentation because I think it'll bring everything into picture because there's so much happening so rapidly. So as you see on the screen right now, this is the latest situation, what we see globally right now with COVID. There's 201,672 cases, 6,496 cases in the United States, 8,000 deaths worldwide, and I'd like to draw your attention to the 82,071 people that have fully recovered from this virus. The reason why I draw your attention to that is because I think we've been focusing so much on the outbreak itself that we haven't recognized the good work that our medical infrastructure has done to help many of these individuals recover. A significant amount of these deaths occurred in China during the beginning of this outbreak. As you see, 3,122 were all part of the China outbreak, with 2,500 in Italy as well, another rapid outbreak. So as you can see in the bottom right corner, the orange curve that you see is mainland China, and then the yellow line is the amount of cases globally, as well as the green line is the recovered line. You can see that the orange line, that is mainland China, has flattened out and has been flat for quite some time. The reason for that are the control measures that were put in place upon the onset of this outbreak. So we've learned through several lessons in Canadian SARS outbreak, what we've seen happen in China and now Italy, that good social distancing, hygiene, and spacing really is a very effective method at reducing the transmission of this virus. In Florida, and I apologize, the map, for whatever reason, is not loading today. I believe it's probably because they're updating it. But we have 6,400 cases, 216 in Florida, and 832 people are monitored right now. We've had 1,017 negative tests with 216 positives, as I mentioned before, and there's about 1,000 tests pending right now. So I just want to talk a little bit about the actual tests themselves and our process. So typically how this works is if a patient becomes symptomatic, we're asking people not to present to their doctor's waiting room for the obvious reasons of we do not want to have transmission to other people in the waiting room, but more importantly also to protect those people at that medical facility to make sure they're prepared to receive someone and protect themselves as well. But should the physician choose to move forward with testing, there is a significant amount of capacity right now in our community as well as our commercial labs in order to provide testing. Quest alone has the capacity and ability to do 20,000 tests a day.
When you say our community,
Yes.
what do you mean?
Meaning our physicians right now have options where to send people, okay? They can do the collection sample themselves and send it through private labs as commercially available, as well as we have several other clinics in the community that are also collecting samples when medically appropriate. And then we are also collecting samples as part of our investigation piece, but we're ramping up even more so to be able to go to more testing capabilities, and that should be coming online this week.
But when you say community, are you referring to Charlotte
Yes,
County?
yes.
Okay, that's what I was.
Yes, ma'am, sorry.
Okay.
So we're waiting right now. We placed a significant order, and we're waiting on some supplies, and once we get those here locally, we will continue to expand our testing capabilities, and more importantly, support those in the community as well. What we're seeing right now is a lot of people that are what we would categorize as the worried well. I feel okay, I think I'm okay, but I just want to get tested to make sure I'm okay. And so because of that, it's causing a significant influx of people inquiring about testing that may not qualify. And so we're doing a lot of education to train our physicians as well as let the community know kind of what the process is, what qualifies people in order to be tested. Essentially, the way we operate is if we were a court, you would be guilty until proven innocent. So if somebody's symptomatic, we assume that the person is infectious, and then we kind of go through a process of rule out. Either way, whether they're positive or not for COVID or influenza or anything else, the same control measures are in place from day one. So the risk to the public is still not there, but then we work through the diagnostic process. This virus looks and acts and behaves much like influenza with significant respiratory issues. And it is also impacting different segments of our population. And I'll go into my presentation, and please, ask any questions along the way if you, whatever you feel comfortable with.
Those websites that you shared, those are on some of the links that have come through to us.
Yes.
And those are really interesting. And I think people would appreciate if we could provide links like that on our website, Howard, because people they want data.
Mm-hmm.
We have an update if you'd like to hear it.
We can wait until after.
Okay.
So we've been pushing out that information not only through emergency management, the Florida Department of Health website, it's on the county website, and I'm pretty sure it's on the city pages as well. And so we're trying to be as transparent as possible, because I feel personally that given the data, people can formulate their own opinions and plans on how to best care for themselves. One of the things that I've been impressing upon people is that it's best to just recognize that if you're sick, stay home. Lots of good hygiene, and if someone around you is sick, try and utilize spacing and then get into care early. Those are kind of the common messages. Everything that I'm going to share with you today, quite honestly, are same strategies that we would use for influenza, and then also potentially even year-round. Not to this level per se, but one of the things that we see year-round is influenza. And so some of these control measures as far as hygiene and spacing and things like that, staying home when you're sick, is very, very effective at controlling influenza. We've had influenza outbreaks in nursing homes and things like that in the past, and we went to, quite honestly, this same protocol of screening all people prior to coming into those facilities. So this is not new to us, it's just applying it to this virus. So what we do know is that this virus originally was identified in China, in Wuhan City and Hubei province. We believe it was at a fish market where was the initial point of identification. Mother Nature every once in a while likes to throw us a curveball. Coronaviruses are typically zoonotic, so they transfer between animal to animal, and then every once in a while it'll transfer from animal to human and then sustained human transmission. And the reason why this virus made the news and was able to transmit very quickly is because we do not have natural immunity to it because we've not seen it. As a result of that, control measures were put in place, and that's kind of how we're monitoring and managing this thing. But essentially, there are several other coronaviruses that we know of: SARS, MERS, and now COVID-19. So coronaviruses unto themselves is just a class of viruses, just like influenza. There are many different influenzas. So the reason why I'm clarifying that is because I think there was a lot of concern over, is this a new type of virus that I need to be afraid of, that type of thing. And if you want to go through some more education on this, just read some of the SARS investigations that happened, like in Canada and elsewhere, where lessons learned. Quite honestly, much of what we're applying today are lessons learned from the Ebola outbreak, H1N1 from years past, as well as the SARS event. And so these are just really good engineering. The controls that we've put in place now, as far as the spacing and things like that, is not because our community is any worse today than it was yesterday. They're just steps to allow us to be much more agile in order to respond to this quickly, rather than convening a board, having those rulings made, and then go out and then procure those resources. So the purpose of this is to get ahead of this so that we can be a nimble and agile government rather than shutting everything down. We really want businesses to thrive. We want our community to carry on with their lives, but just do that responsibly in a safe manner. And so that's where we're at with this thing. As far as with the school closures and extending of spring breaks and things like that, what happened with all of those things is there are strategies that we've identified through our investigations as part of surveillance and lessons learned from Italy and other places, that many of the students in the university settings were just on the eve of spring break. as well as faculty and our schools going on spring break as well. We know during spring break, people go on cruises, go out into other areas, travel internationally, things like that. As a result of that, should anyone become impacted by this virus, they would be returning back and into the classroom setting just around the time where we would be needing to monitor them to make sure they're not symptomatic. And so in order to prevent kind of an explosive outbreak in our schools and in our universities and in our community, it was good judgment and guidance by the CDC as well as the state in order to provide this spacing in order to protect those bodies. And so that's where we're at. This is really a protective strategy, not a reaction to anything getting worse. It was really to try and break the cycle of transmission. So we know that this virus looks and acts and behaves like the flu, and we recognize that the amount of viral presence is really in the lungs and in specifically the mucus produced when you're symptomatic. And so therefore the guidance has been droplet precaution, meaning that covering your cough, covering your sneeze, washing your hands, eye protection for our medical responders, as well as airway protection, so that if they're around somebody who's coughing, they don't breathe in those droplets, much like influenza. If you're around somebody who is sick with the flu, typically we provide spacing, wipe down surfaces, and kind of distance ourselves a little bit and protect ourselves from their cough and sneeze. And it's really the same thing. And so that's why we made these recommendations. One of the things with COVID that might be a little bit different than some of the other viruses is that they have a component to it for individuals with, especially with underlying disease like other respiratory issues, where there's a difficulty breathing component to this as well as pneumonia. And so the process that we're going through with our medical providers, and the guidance has changed dramatically because it used to just be only international travel to those areas. Now, because of the prevalence, it's really if they've come into contact with a known case or travel to a known area, that type of thing. And so it's a process of elimination. We're ruling out influenza, strep, anything else that could be indicative of why the patient is presenting in that way. And if there's no other explained explanation, then we go through the process of COVID. What we have been finding is a lot of influenza and other things. Just recently, I saw we had about 23 cases of flu just in Charlotte County last week. So if that gives you an idea, we're still seeing influenza. To put this into perspective, we all remember H1N1 and how scary that was when it first came out and it was an outbreak. What most people don't realize is we've seen over 1,000 cases of H1N1 this flu season alone in Florida. But that's not really something we're talking about now because our medical providers have seen it before, they know how to treat it, and we kind of move forward together. The individuals that are at risk for influenza are the same people that are at risk for this. In looking at the data, people over 80 years old were in the highest risk category for this. It seems to be disproportionately impacting our older adults. And it's understandable because most of our older adults have other underlying issues to deal with, mainly respiratory issues. So that's why we're very much focusing and protecting our nursing homes, our schools, and providing the good spacing that we are. Charlotte County is the second oldest population in the United States. 50% of our citizenry are retired and live in our community. And so what we're doing is putting in good controls now in order to protect our community. So essentially, we have testing capability. It started out only at the CDC. That has since expanded into our state labs. And then we've since expanded that even further to being commercially available now for our medical providers. And basically, we are sending out treatment algorithms and testing protocols so that our physicians know what to go through the process in order for the screening. And then they would consult with us if needed. If not, they just move forward with the testing. Should we get a positive result, we are immediately notified just like any other reportable disease. And then we go through our process with contact tracing as well as ensuring that all of those control measures are in place to prevent spread. So what I would say is that there are probably two major sources of information you could go to. One is the Florida Department of Health website for COVID-19, and the other one would be the CDC website for COVID-19. We are continuously pushing out information to all of our partners, as well as we will continue to push out information through emergency operations to dispel rumors, myths, and anything like that. The World Health Organization put together a really great Mythbuster page as well, and we've pushed that out to the community. So essentially what we're asking is to avoid contact with others. If you're sick, especially stay home and call your physician. Do not travel while you're sick. Cover your cough. And wash your hands. Soap and water works on this virus, just like it would with influenza. Hand sanitizer works on this virus, so long as it has 60% alcohol in it. But essentially, it's really good prevention measures. Anything that you would use to keep yourself healthy during flu season would be the same things you would be doing with this. The reason why we're promoting spacing is because we know that if one person gets this virus or a cold, the fewer people that are around, that's fewer people we have to be concerned about as possible transmission. We also know that the transmission of this virus happens more when somebody is symptomatic versus when they're asymptomatic. That's why we have people monitoring. If they're on our watch, we have them monitoring twice daily for symptoms and checking their temperature just to make sure that we catch them very early and isolate them prior to them becoming symptomatic for transmission to other people. And that goes back to the control measures. The major countries that have been impacted significantly that the CDC has categorized as a level 3 are the countries that you see on the screen. These advisories are changing rapidly, so that's why I recommended monitoring the FDOH page as well as China, or as well as the CDC page, because it's not just China, it's several other locations, as well as we put out alerts. Specifically, you saw recently for cruise ships. We had an alert recently for the Nile River cruise to Egypt. We put out another alert recently for a cluster of individuals that was working at Port Everglades in Fort Lauderdale that were supporting cruise ship operations. So as we get the data, and that's where our testing comes into play, because we're using it as our research to understand linkages between cases, and then we push out those alerts to specific warning areas that we need to be concerned about. Most recently, we had an alert for a conference that was in Tampa, so we pushed out an alert specific to that. So we're really trying to give the public as quickly as we can information regarding any type of potential exposure that they may have been a part of, so that they can monitor themselves and then seek care quickly. But I have to say that our community has been very supportive and responsive. The hospitals, our nursing home facilities, and all of our responders have really taken this seriously, and we have been prepared for this for quite some time, even prior to the emergency declaration. We started conversations back in December, and I am very proud of what we've done in our community. Having been here since 1985, I can tell you that we're a resilient community, and we do pull together when we need to, and this is one of those times. I know we'll get through this. I know this is not going to be a permanent normal. This will pass, and we will resume life as we once knew it before. And quite honestly, some of these things, as far as a infection control perspective, are really just good, healthy behavior for our community anyway. Not so much to this extent, but just recognizing how we can kind of help each other. And then from a philosophical perspective, this virus impacts everyone. So we rise to defeat this virus together as a community. Just some quick highlights. I highly recommend that if someone is concerned, to please reach out to their physician and have that conversation with their physician, because they know their medical care and their history. If they become symptomatic, to stay home, and then please work with their doctors and find out whatever treatment they need. Some people may be ill, but not necessarily need to be tested for COVID. We still have a lot of allergies going on right now as well. So there are lots of other reasons why someone could be symptomatic. And then just to bring it all together, we have one case in Charlotte County that was diagnosed, and we are in the process of clearing that case right now so that that person is doing well. So I just want to kind of put all of that into perspective, because a lot of times we focus on the worst of all of this. And it is very impactful, and especially for those families who lost loved ones. But our medical providers are doing a great job in sharing information with each other. I've had meetings with the Medical Society. We had, before it was allowed, we had 70 doctors together, and we had the conversation. Now we do conference calls. But we are constantly sharing best practices, and there's lots of really promising treatment protocols from the perspective of what we know already that works with influenza and antivirals, but also some treatment protocols that are being learned from international physicians that have been battling with this, using different viral medications that typically could have been used for HIV and other things. So we're really getting better at this. And what's really exciting about this is 2 days ago, Kaiser Permanente went to their first human trial of vaccine. So when the CDC released the map of this virus over a month ago, within hours, several companies announced that they had a formula for a potential vaccine. They're using supercomputers to model these things. And now the global competition is on as to who can get to the market first with a vaccine, which is great. The other part of that is we've gone through some trials already. We saw with Kaiser Permanente. I know elsewhere and around the world they're doing the same thing. The next chapter in this is, ramping up production and then making sure it's safe and then going into full swing with vaccine. There's been lots of really good promise with this virus as far as people working together to try and come up with a solution. But that's pretty much it. I've shared all of the web pages with you. One last thing I'd like to leave you and the community is there's an 800 number. There's a call center. You can call 24 hours a day, 7 days a week, as well as an email. And that's on the screen right now. It's 866-779-6121. 866-779-6121. It's also on our webpage if you don't have it here, as well as an email, covid-19@flhealth.gov. So you can submit your questions or call, and they'll be able to answer your questions. And then they're also working very closely with us if the person needs to be routed back to the local health department. And we have doctors and nurses that are fielding calls here in Charlotte County for the worried well, as well as anybody else who might have some questions and they're not feeling well. And we're trying to route people the best place possible for their care. And with that, I'll answer any questions you might have.
Questions?
I have a couple.
Yes, ma'am.
What is currently being done to get people back to good health for those who are actually identified as carriers of the disease?
So a lot of folks, quite honestly, are recovering at home. So they're just lots of rest, hydration, typical supportive care that you would have for somebody with a virus. Some people may need additional medications from their doctors. It really depends on their medical condition. If they're, if they have asthmatic or COPD, things like that, they might need breathing treatments and stuff like that, just to support them as they would anyway. And then if they need to be hospitalized, we have protocols in place for working with them to get to the hospital and get the care they need there. Again, if we can get them to care earlier, that's always much better. And so the doctors are really doing a good job with that piece of it. But that's really a supportive care right now until we have some better options as far as vaccines and some other things for prevention.
So like no antibiotics are given as a standard?
Antibiotics work on infections, bacterial infections, not viruses. So they would be getting more of an antiviral strategy rather than an antibiotic strategy. The folks that struggle with this, that get the pneumonia, the biggest concern there is the fluid on the lungs becomes infected and they get this super infection where they would need antibiotic strategies on top of that. So that's where this kind of progresses to a higher level of care. My assumption is that if somebody is at that level, they probably will be in the hospital getting that level of care, just because for the amount of support care they would need, and they'd probably need an additional higher level of monitoring.
And do the people that are being hospitalized, do they normally have more than one of the symptoms?
They're symptomatic, obviously, for COVID, which are flu-like symptoms, but typically what we're seeing also is that they have significant other underlying conditions. And so that's what's complicating this. For most of the folks that we're dealing with, they maybe will go to the hospital, maybe they'll spend a night or two, but then they end up back home. And so that's from the cases that I'm hearing.
I ask that because there's so many pollen and so many things in the air
Yes,
right now that
I
with
mean,
allergies,
as you
people
hear me
think
right now, yes.
people get
So-
paranoid, and just to clarify what the differences are between allergies and colds and all of
Yes.
that.
So-
I think that's a really critical part.
Yeah, I think the biggest piece of it is when in doubt, call your doctor. I think, and let the doctor decide, because they know your history.
Yeah.
My doctor knows this time of year, I can almost mark my calendar that I'm having allergy issues.
Absolutely.
And so they already know. The other side of it is that if the doctor is familiar with the patient, a lot of times they'll push medications to them in advance so that they have their inhalers or whatever they might need should they get sick, or they know what to do. Most of people who have chronic underlying disease elsewhere are usually pretty familiar with treating their symptoms and what happens when they get sick. And so we're just working with our physicians to kind of make sure that they're leaning forward in this posture to support. The other side too is we've opened up, under emergency declarations, pharmacists are allowed to dispense medications a little bit differently based on the declaration of emergency as well as upon discharge of people coming out of the hospital to make sure that transition period from being hospitalized to being home, they have the ability to dispense at the hospital level to make sure people can maintain their medicine. The last thing we want them to do is fall out of care and not have enough time to get their medication, and then they end up back in the hospital. So we're trying to come up with some better overlapping strategies to prevent that.
Nancy.
Debbie?
Could you clear up the pet to human
Oh,
thing?
yes,
'Cause
thank you.
My husband's a vet. We get asked that all the time.
Yes, thank you. I get asked that too. So let me tell you how it works in my house. So it's my son and the dog. They're kind of neck and neck as to who takes priority. And then I'm about fourth in the list. So I'm pretty sure that if I get COVID, I'm going to be out in the backyard and the dog will be in the bed with me. So there was some miscommunication as far as the transmission of dogs and animals and things like that. What I read and some of my research is that where the information started, and the World Health Organization has a great Mythbuster link. You can go to that for more information. But they think what happened was some of the RNA from the virus was present on the animal, and so that's why they kind of thought maybe this was transmission through dogs and that kind of thing. But that doesn't seem to be the case, because with the amount of dogs in the world there are right now, we'd see a massive proliferation, and we would have seen that sustained transmission already.
Thank you. I just wanted that on the record.
Yes, ma'am. And my dog Frosty is happy right now too, just hearing me say that. So.
May I share with you a few? I was involved with the H1N1 and
Sure.
bird flu, and a few things we did, and then reflect on whether they're relevant now. One thing we did was, again, very good cold flu hygiene in terms of that, and in terms of really just always doing that. Basically, if you're sick, don't spread it to other people.
Right.
The use of masks we did, it wasn't really to protect ourselves from other people, but it actually was to protect other people from us. And so when you see, like in Asia, people wearing masks, it's actually they're sick people who don't want to give it to others. So that was one thing. 3, the emphasizing of people staying home. Like there were several major epidemics that were avoided simply because people didn't go in and got other people infected. And so I guess emphasizing the fact that if you have issues, call your physician. 4th, we used these thermal cameras at major ports of entry and crowded places so we can at least take people's temperatures, see what that were. And then lastly, we had plans with hotels for staging areas in case there was a major issue that we can have staging for physicians or mobile hospitals. So.
Right. Yeah, and we've been looking at all those things. Quite honestly, you can imagine if we used a hotel as a makeshift hospital, the impact that would have on that business later on when we even try to convince people that it's okay to go back to that hotel could be problematic. So we're trying not to infringe upon businesses. And so there's lots of empty vacant spaces within the county. So we're looking at all of those things. Should we have to go to a mass care model as well as even a mass testing model? You're correct with the CDC guidance with wearing a mask. If you're healthy, you don't need to wear one. And basically, there's some evidence that suggests by wearing a mask and when you don't need to, suggests that you would be touching your face more. Just because you're constantly adjusting the mask would put you at more risk rather than wearing the mask. What we talk about with the mask, especially for our first responders, is putting a mask on the patient if they're coughing, because we know that they're coughing and ejecting respiratory droplets, and to kind of minimize that spray. And so that's sort of protection for the responders. And then obviously, clearly, they're using eye and airway protection as well. But yeah, all great points. And yes, just to kind of let you know my history, even though I was in higher ed prior, I did a lot of the campus safety models and things like that, as well as I was the emergency planner here for the health department in Charlotte County. And I was blessed with the Ebola excitement that went on. And so it was a lot of lessons learned during that time as well. So a lot of the things that we're putting into play right now are some resources, quite honestly, that we put into play and staged from the Ebola preparation. So we have caches of supplies and things like that to support our infrastructure, and we're in the mode right now of doing a push from Tallahassee to support our infrastructure as well.
Question about there seem to be some, I don't know if you want to call them hot spots, but warmer spots in
Yes.
Florida where there are more diagnosed cases than
Yes.
certainly Charlotte County. And so has the Florida Department of Health been able to disseminate information about what has caused that in those areas? Some residents' inquiries at least I know to me, are expecting us to take action about and it's like, well, we're following what we're asked to do. And they want us to, they see like over in Miami, they hear that the restaurants are being forced to close and et cetera, things like that. And it's like, we're doing what we're being asked to do.
Right.
We're not we're being precautionary, but we're not trying to shut everything down.
I think the goal is to be prudent, what's appropriate to protect our community, as well as to not cause panic.
Right.
What we're seeing right now with our cases, we know that the higher density populations, like what we saw in China, people are closer together inherently. And so as a result, there's a higher potential for coming into contact with more people. What we're also seeing with these cases on the screen, I brought it up, is the amount of travel-associated cases we have. One of the things that I'm constantly surprised of is how global we are, even in small Charlotte County, with the amount of people that travel internationally. So, and we are in the cruise season right now. So those are all challenges that some of those communities have had, and they're also port cities for cruises. So those are also some major challenges. They were also international hubs for the airports and people coming through those communities. So those are all parts of things that inherently kind of give them a little more exposure. We don't have any ports. We have a domestic airport, and so our folks are doing a good job at that side with screening.
Okay. More questions? No? Thank you. This was very informative, and I hope that everyone at home appreciate that as well. And certainly, Howard, would you like to give us then the update on what you're doing with our website? You mentioned something, you're going to do
Why
something?
don't we do the emergency ordinance, and then we'll give all the updates.
Okay, so what we would like to do, if your council members are okay with this, is we can move the emergency ordinance up in the agenda to now, and then we can go back to our regular agenda, if that's okay. It seems to be topical. So we have an ordinance which was added to the agenda, and we will take citizens' comments first on the emergency ordinance. Do you want to read the title?
Yes.
And then we can take
Yes.
the comments.
This is the first reading of an emergency ordinance that'll be read by title only. An emergency ordinance of the City Council of the City of Punta Gorda, Florida, declaring a state of local emergency and providing for emergency governmental operations related to novel coronavirus disease, COVID-19, providing for termination of emergency powers and providing an effective date.
So we will take citizens' comments on this emergency ordinance. If you would like to comment, please come to the podium, and you'll have 3 minutes. Seeing none, we'll take discussion on this. I just have one question. I noticed in this emergency ordinance, it states that it will end when the state ends theirs, as opposed to Charlotte County that ended theirs every 7 days.
Well, Charlotte County's talks about 7-day increments, and rather
Yes.
than have us come back every 7 days, we felt, let's just be in sync with the state emergency declaration, and that way we don't have to keep coming back every 7 days, and that gives us a little more flexibility.
And I agree with that. I just think it was important to for you to be able to at least discuss that, so that people at home understood what we were doing. Do we have a motion?
Make a motion for an approval of the emergency ordinance.
So, there's been a motion and a second. Did you get them?
Second?
Second was Jaha. All those in favor, please signify by saying aye.
Aye.
Those opposed? The motion carries unanimously.
Okay, so this is something that we've done a few times. We're quite good at this when it comes to hurricanes. Hurricanes, they give us plenty of time ahead of time. The hurricane comes, we get all of our preparedness, we go through the hurricane, and then we restore. We're in uncharted territory here. This is a little different. But what this does is provides us the opportunity now to set up a project code within the city staff for emergency preparedness. We track everything, and if our local governments are going to get reimbursed at some point in time, we will have that information, just like a storm event. Procurement policy, same as a hurricane, emergency declaration. We pretty much handed the reins over to the administration to operate, although council members are continuously in the loop. Boards and committees, we will be sending out notice today, now that we've adopted this, that our boards and committees meetings will be canceled until, well, definitely the next round. We don't know, it may go beyond that, but we are going to be canceling boards and committee meetings.
How does that affect public hearings that are already scheduled?
Well, we don't really have,
The planning commission is the one that,
but down the
Goes
planning
only about-
commission, we have the interstate,
that would be the only one that would meet?
yeah,
We also have the Code Enforcement Board,
code enforcement, but we will have to extend it.
so that will be extended. Very good.
And there's no more penalties adding on, we'll be extending that. Because with the code enforcement board, there's, with the number of cases, there's going to be too many people here.
I'm not disagreeing, I just wanted to make clarification.
Yeah. So we'll be sending that notice out as well.
However, I had a question from somebody about the planning commission. If it's canceled this month, then the cases that were gonna, or the, things that were gonna be heard, they'll go clear to the end of next month. We can't move it up, like let's say that this goes away and we can schedule things, do we
Oh,
try
then
to
we,
fit them in?
if we have to, we'll make some adjustments.
We would do that,
Yeah.
okay,
But right now, all the boards and
understand.
committee meetings scheduled through March
okay,
will be canceled.
okay.
The weekly report Friday will be included, just like we have with storm events, an update of what all the departments are
Sorry,
doing.
can I just clarify about the boards and committees? We'll be notifying the board members of the cancellations. Are we going to notify them that they're only canceled through March, and then we'll have to communicate with them again? Or do we want to tell them until further notice, and we'll let them know as soon as we
I would say
know
until
when we'll-
further notice.
I think that would be just.
Until further notice.
That will help you out, Karen, I
Yeah.
think. So you
Yeah,
don't,
you don't have to do it more than once. then.
yeah,
Yeah,
you can
that's
just let
good.
them know once, and they can always check the city's website, so if we can put
We'll keep 'em
for the current information.
Yeah, until further notice.
Okay.
The weekly report will do what we've done in storm events, have an update of what all the departments are doing. Again, we do a lot of our work very quietly, very prudently, so we'll just have bullet points from what all the departments have been doing. So, our website, our communications manager will give you an update of the website.
Certainly. I had Melissa Reichert, Communications Manager. I had a little bit of time last evening to start to pull together all our resources in one place. Our web vendor, Granicus, had a nice template for us to use. So right now we have the frequently asked questions, we have links to the CDC, links to the Florida Department of Health, and this afternoon I plan to invest time in building that out a little bit more robustly as well.
The Mythbusters.
Mythbusters is already on there. You just
Okay.
need to click on in the spotlight button on the front of our website, and it goes directly to that page, and all the information will be right there in one place. It also pulls up our Facebook and our Twitter feeds onto there, so anything that we're communicating that way automatically populates to the website.
That's Perfect.
Okay, two more things very quickly. First, I'd like to have Ray Briggs, our Emergency Management Director, just get up, say a few words about communication and coordination with our assisted living and nursing homes.
Sure. Ray Briggs, Fire Chief. So we got started with this pretty early. As you know, Sarasota, Manatee County had one of the first cases around. So I really feel like we've been ahead of the game, kind of ahead of the curve, and that it kind of forced us to take a little, more proactive stance. So what we've done to date, man, it seems like it's been going on for a long time already. The days are long. We've met with, so first of all, we looked at mass gatherings and the groups that, our most vulnerable group, being our elderly folks. And so we met with we reached out to all of our faith-based groups, right? So if you look at a typical weekend in Punta Gorda with all of the faith-based groups, we can all venture a number, but somewhere between 6,000 and 8,000 folks attend. So we held a meeting. We brought in representatives from as many of those groups that we could get to attend, which we had good positive attendance. So we talked about some best practices and reducing services and things like live streaming, all of those things, and really had good positive feedback. So you see some of that happening at different levels, and so that we've had really good feedback from that. We obviously with the restaurants and all we've met with them as well. From a personnel perspective, we've kind of approached it kind of two-pronged. We feel like first we take care of our first responders that are going into thousands of homes a year with sick folks, to make sure that we have robust PPE, personal protective equipment in place. We're doing well with that. We're responding to calls regularly where they have the flu-like symptoms. Some are worried well, some are not. But from the clinical presentation, it's tough to really tell what you have until you're in that environment. So make sure our personnel are first and foremost protected, so we keep them safe. We've gone to changes in our process, like reference our stations are sanitized three times a day. They wipe down all hard surfaces and panic hardware and all those sorts of things, so that again we have to keep our folks healthy, to ensure that workforce. The second side of it was through public education. So you see posters and things like we saw this morning when you're coming in and dealing with Dr. Joe. We've certainly we've become very close. We're good friends now, and so we're dealing with them as well. So again, we continue. I think if there's a lot of good information out there, there's a fine line between panic and preparedness. Mm-hmm. And I feel like our position is that we really wanted to be the calm in this storm and provide some sanity and some folks. So it's working fairly well. So any questions that you might have?
I'd like the police chief to get up here and talk about policing tactics.
Can I just, I would really like to thank you and your quick responses to all of our questions. You really,
Yes.
you are on there. Thank you so much.
Let me know what we can do.
Your response in regard to yesterday's St. Patrick's Day was particularly valuable to be able to forward that on to many additional residents who have raised questions.
What we're here for.
And it helped people understand that, we really, we can't, we're limited in some ways as to what we can and should do. And we're all asked to use good judgment.
Right.
So.
Be responsible, sure. Thank you.
Good morning, Pam Davis, Punta Gorda Police Chief. So we've taken a lot of precautions as well. We're actually on the 9 o'clock emergency operations call every morning. We are part of the Charlotte County Pandemic Committee, so that meets on Wednesdays. Big thing about the first responders is we do need to make sure that we can protect them as much as possible, because we need them here, and we don't want to see things spread quickly. So we have a system in place with our dispatch center where there's protocols that if certain things come in, they will alert officers and our fire personnel universal precautions. So they'll put PPE equipment on. For example, we had a well-being check. Just one of our officers had to respond to a well-being check and flu-like symptoms. So immediately he had to don on all the equipment. Sanitizing the cars, sanitizing the workspaces, particularly dispatch consoles. That's a close environment in there, so they are constantly making sure that they're wiping everything down. One of the things that we are encouraging our residents is if we come to a non-emergency type call, can you please step out and we can take the call in kind of an open, more air environment, just to get some spacing in there. And a lot of those very low priority type calls, we might even be taking some of those calls over the phone. But if anybody wants us to respond in person, we will absolutely respond in person. So, you know, we've got to provide the best service possible to the community. So, any questions for us? Yes, ma'am.
So how are we going about the policing of the governor's mandate?
So the governor's order about closing bars, which was at 5 o'clock yesterday, and reducing capacity at restaurants by 50%. So first thing we had to do was determine what are the bars, what are considered just bars, and what are restaurants. So we were on the phone with ABT yesterday. They're working very closely with us. There's still a little bit of direction that we're trying to get on enforcement, what type of enforcement actions we can take. So the first thing we did was went out to as many restaurants as possible yesterday and invited them to a meeting to kind of discuss, hey, this is what it looks like when you're at 50% capacity. We're going to have that meeting later on, and we will practice social distancing at that meeting. But for the most part, at 5 o'clock yesterday, but actually we started delivering before then, just about everybody was cooperative. We had a couple which we knew for a fact were bars shut down with no problem. So what we're saying right now is, you know, if somebody has a belief that a restaurant is over capacity, they're not following the guidelines, just give us a call and we are going to go out there and gain. The goal is to gain voluntary compliance, really. So that's what we'll do.
Thank you.
Thanks. Billing and collection, the utility bills that will be sent out starting yesterday, as a matter of fact, will be including a statement that we will be not doing shut-offs and not doing penalties as we get through this. So that's being handled. And our building department will be sending out, if they haven't already, to all of our contractors and customers, try and do online work as much as possible. There'll be hand sanitizing equipment, or whatever you want to call it, in all of our areas where people come to City Hall, or Public Works Utilities, or Public Safety Building. So all that's underway. And we'll have an update in the weekly report. So that's, have I left anything out that anybody else want to? We got enough?
I have a question. So we mentioned that the committee meetings. What do we want to do about our April 1st council meeting? Do we want to continue to hold the council meeting? Or do we want to wait and not meet until April 15th? Do we want to have 2 meetings in April? April is a 5-Wednesday month, so we could still meet twice. And then if we only meet once in April, then that uses up 1 month that one of our.
Well, then we go back to our 2 December meetings.
Or two in August.
That's a problem, because people have already scheduled things.
Yeah.
What would be the rationale for canceling in 2 weeks?
I'm just offering, you know, I'm not saying we have to. I'm just bringing it up as a.
I'd like to keep things as normal as possible. I think if we start if we do that, it could appear to people that we are panicking. I'm in favor of keeping things as normal as possible.
Can we have a meeting without an audience present? Is there a way to teleconference it that people can participate? Because that's what I've been getting a lot of comments about, a lot of comments.
I have been reading daily emails being circulated by many local government attorneys on the question of the emergency and the sunshine law. And the consensus seems to be that there is no provision in the sunshine law to dispense with the requirements of the sunshine law, even in the times of an emergency. So the answer, my recommendation would be no. You know, the public is entitled to be here. If they're just wanting to watch, We know, they know or should know that they have an opportunity to watch during, the way that we present the videos live. But there is no way that they can participate without being here.
I can tell you that Bonita Springs has canceled their city council meeting coming up, and Venice is also planning to do the same. That I do know for a fact, just as reference information. Doesn't mean we have to, but I think we need to take the lead and be proactive about it as much as everybody else. And I am concerned about continuing to have these meetings during this really weird time, because people are really, really scared. And I understand wanting to keep things normal, but I also want to make sure that even the council members and city staff are kept healthy. And we've got to continue doing our jobs no matter what. But if any of us get sick, it's, bets are off. So just the other side of it.
I mean, I personally think if we do the measures, the recommended measures, I don't see an issue. Like I said, I personally, for 20 years, worked in Asia with several pandemics, which were actually, considerably more dangerous, and we were able to manage to maintain day-to-day lives. We just took our precautions to make sure people didn't spread things to each other.
John, you were a hospital administrator.
Very quiet today, yes. It seems that all around us, people are making these decisions. What is the county doing? Are they still meeting there?
They met yesterday. I've not heard that they've canceled any meetings.
Yeah.
Oh, boards and committees, yes, they've canceled all of those.
Okay, yeah.
And
But I agree with Debbie that we got to make it seem as normal as possible, because, we're pretty well protected in this situation with all the wipe downs and everything else and keeping our distances. And obviously, if any of us don't feel well, we shouldn't be here, kinds of things.
if you decide to have an April 1 meeting, we can certainly put an agenda together that really limits what's going to be on there. As a staff, we have no issues if you do cancel the April 1st meeting. It's either or, but we can certainly limit what's on there. And as you can see today, we don't have very much.
I would think that, I certainly understand Lynn's comments and us demonstrating that we want to be responsible. On the other hand, I get we want to maintain a sense of calm and assurance to our community. And we could do that, limit. I know I had one resident who said they wanted to come today to comment on something that's not even on our agenda. So, and I said, really, it's not on the agenda. There's no reason why. You're welcome to come, but I can't tell you not to, but I can tell you that if it's not on the agenda, then you're probably better off to stay away and stay safe.
We have a number of first readings of public hearings on our agenda today. As you can see, it really hasn't generated a whole lot of public comment. And usually, as you know, second readings are even less. So you can maybe take that into consideration.
Well, we'll keep the wheels turning. So if we could do that to limit it so that it's really not as restrictive, it seems like we have.
Because like right now, we're practicing our spacing. Our audience right now. I think if we do.
Yeah, I don't know if people that are on TV,
those
watching
things
from
they can't
TV can see the
Yeah.
audience, but, every other chair has a sign that says this seat must remain unoccupied. So we're practicing what we're preaching. Okay, so then we'll go ahead and we'll meet on April the 1st, and
We will keep the agenda, we will put an agenda together that really limits what's going to be.
And speaking of April the 1st, Vice Mayor Matthews reminded me that some people may be here for the air show, because we talked about the air show and that we would have it on our next agenda, and we do not have it on this agenda. So if anyone is here for the air show, then it's
Postponed to
April 1. So.
Now, that'll be a big discussion, so is that appropriate in this situation?
If they're ready by April 1. Remember now, they have to satisfy our police, fire, and public works.
What, can we push that back to the second meeting in April? Just for safety reason? I mean,
I also don't hear Coast Guard in that phrase, and it seems like the Coast Guard has to be involved too.
I think they still have a lot of work to do with
Yes.
public safety issues, so.
We will get together with them.
Is that reasonable, Pam?
Yes, Pam Davis, Punta Gorda Police Chief. Yeah, that's reasonable, but I will say that I know that Mr. Carr had expressed that he had to have some kind of decision made by the middle of April. So, but we have not been contacted for our second meeting yet, and I do
So
have
the
a.
second meeting would be April 15th.
Well, for our second meeting, we were planning to hopefully have one before the April 1st meeting, and
Yeah.
we've not even been contacted about that
Well,
yet,
I mean,
so.
they have the temporary permit.
Yes,
the
so I mean,
conditional permit, so.
if you push it to April 15th, that'll give them some more time to get some of that decision-making done.
Okay, I would think that's a good idea.
Yeah, especially if it's going to draw a lot of people here
Yes.
to the audience.
Okay? We will let them know.
Okay. Jahab?
Just one more quick thing. It's basically, we just want to let the public know that the Small Business Emergency Bridge Loan Program is activated again because we're we had disaster declaration, and that's FloridaDisasterLoan.org. That's for businesses to be able to get a bridge loan to be able to have continuity. So just let people know that in the same way like a hurricane, this program is active now, so our businesses can avail of that.
That's a good item, and we can probably ask Melissa if something like that could be included on the webpage, because what the idea is, it's just one place for everyone, for all of us to refer people, so that there's a good source of a flow of communication, so. Any other discussion on this? Okay, then we'll move on, and we'll go to our agenda. We did not get to the introduction of board and committee member nominees. If anyone is here to introduce themselves, because you are submitting your name for a board or committee member, we would certainly love to meet you and get to know who you are, and so please come to the podium. You have 3 minutes. Okay, seeing none, then what we will do is move right into our public hearing agenda. We have quite a few quasi-judicial public hearings today.
Yes, the next 4 items, two of the 6 have been, will be rescheduled, but the next 4 items are quasi-judicial public hearings. So anyone that will be providing any testimony or evidence in any of those public hearings needs to rise and be sworn by the city clerk at this time, please.
Raise your right hand. Do you solemnly swear or affirm to tell the truth, the whole truth, and nothing but the truth in today's proceedings?
I do.
Thank you. When you're ready to speak, please come to the podium, state your name, and indicate that you've been sworn.
The first item, AX-03-19, is the first reading of an ordinance that I'll read by title only. An ordinance of the City Council of Punta Gorda, Florida, annexing within the corporate area of the city of Punta Gorda, 19.51 plus or minus acres, being a portion of Section 33, Township 41 South, Range 23 East, more particularly described in the boundary survey attached here too, and addressed as 11220 Burnt Store Road, in accordance with the voluntary annexation provisions of Section 171.044 Florida statutes, redefining the boundary lines of said city in conformance therewith, amending the official boundary map of the city of Punta Gorda, Florida, directing the city clerk to provide certified copies of this ordinance to the Charlotte County Clerk of Court, Charlotte County Administrator, Florida Department of State, and Florida Office of Economic and Demographic Research, providing for conflict and severability and providing an effective date.
Good morning, Lisa Hannon, zoning official, and I have been sworn. I'd like to enter the staff report in its entirety into the record by reference. Staff has received and processed the voluntary annexation request for 11220 Burnt Store Road. The property has an existing single-family structure on site, and currently the property owner does not have any development plans for the property. This process allows the applicant to become part of the municipality. It contributes to sound growth and strengthens our municipality. The application is consistent with the City of Punta Gorda 2040 Comprehensive Plan elements, including future land use, transportation, and intergovernmental coordination. The CAP application is in order and has met the statutory requirements. It's consistent with the city's comprehensive plan, specifically the future land use element 1.1.2.1 and 1.1.10.1, and the transportation element policy 7.1.6.1 and 7.1.6.3. All of these are outlined in the full staff report that we've entered into the record. A large-scale comprehensive plan amendment and rezoning amendment are required. However, those have been postponed until later. We will re-advertise those at a later date. The applicant will be required to address water and wastewater issues pursuant to the Exhibit B that is attached to the proposed ordinance, and any development will require DRC approval. The Development Review Committee recommended approval with contingent upon addressing utility expansion request. Planning Commission did recommend approval, and City Urban Design staff recommends approval contingent to the City Council approval of an agreement to provide water and wastewater services. We're here with any questions.
Questions?
What is staff's position on the wastewater and water access to that property and the other one that'll be coming up?
Okay, this property at 11220 is served by water. It has water services to it. It would be between the developer and the city utility to work out the issues with any water, wastewater capacity issues at the property owner or developer's expense.
That was the operative statement I wanted to hear, because I am adamantly opposed to the city paying for that. Thank you.
Okay. Are you the applicant?
Yes, ma'am. Tad DeMelli. And
Okay.
I just want to say thank you all for the opportunity to be.
Do I have to open the public hearing first?
No, but just identify for the record that you've been sworn, please.
Myself, John W. DeMelli, and my wife Gloria DeMelli. I go by the nickname Tad, so just if I confuse anyone. But I just wanted to take the opportunity to say thank you all very much for your consideration. And I would like to take the opportunity. I served 14 years in public government in Homestead, Florida, and I took a great deal of pride in our building and planning and our staff. And I want to say that you all have a fine staff with Lisa Hannon and the folks with whom she works. Thank you.
Thank you very much. Appreciate that. We think they're pretty special as well.
Yes, thank you.
Any questions for the applicant? This is a public hearing. If you would like to comment on this, please come to the podium. You have 3 minutes, and please state that you have been sworn. This is a public hearing. This is the last call. This is a public hearing.
Motion to close the public hearing.
Second.
There's been a motion and a second to close the public hearing. All those in favor, please signify by saying aye.
Aye.
Those opposed, motion carries unanimously. Good to go.
Thank you.
Discussion. I think your question and your concern, that's been the discussion with the developer of the property all along, that they would need to be responsible for paying for any wastewater. And so they're fully aware of that.
I just wanted it on the record.
Yeah.
I'll make a motion, we approve AX-03-19.
Second.
There's been a motion and a second to approve AX-03-19. All those in favor, please signify by saying aye.
Aye.
Aye. Those opposed, the motion carries unanimously. Congratulations. Do we know how soon that we will be able to then review what is currently item 2 and 3? Lisa? We're hearing is being rescheduled?
Our original goal was to put it on the April Planning Commission and then the May City Council meeting. It's going to depend on the emergency situation as of now.
Okay.
If we have a planning commission meeting in April, we'll get it going.
Okay.
And since those two items are going to need to be re-advertised anyway, we're not going to be opening up the public hearing and continuing as we do sometimes in other situations. So the next item on the agenda
Is AX-02-19. Number 4.
that is correct. Yep.
Okay.
And so that is the first reading of an ordinance, which I'll read by title only. An ordinance of the City Council of Punta Gorda, Florida, annexing within the corporate area of the City of Punta Gorda, 16.33 plus or minus acres, being a portion of Section 33, Township 41 South, Range 23 East, more particularly described in the boundary survey attached hereto, and addressed as 26150 Angelica Drive, 26041 Cuneo Road, 26021 Cuneo Road, in accordance with the voluntary annexation provisions of Section 171.044 Florida statutes, redefining the boundary lines of said city in conformance therewith, amending the official boundary map of the City of Punta Gorda, Florida, directing the city clerk to provide certified copies of this ordinance to the Charlotte County Clerk of Court, Charlotte County Administrator, Florida Department of State, and Florida Office of Economic and Demographic Research, providing a conflict and severability and providing an effective date.
Good morning again, Lisa Hannon, zoning official, and I have been sworn. I'd like to enter the staff report in its entirety into the record by reference. Again, staff has received and processed this voluntary annexation request for 26150 Angelica Drive, 26021 Cuneo Road, and 26041 Cuneo Road. The properties are currently vacant. There is a planned development rezoning amendment that will be moving forward along with this request and the comprehensive plan amendment to move forward for an assisted living facility for the first phase, and then a future phase of a potential 100-unit independent living facility. This annexation brings the property into the city boundary, lets it become part of the municipality, also contributes to sound growth and strengthens our municipality. The property at 16.33 acres, after the approval of annexation 0319, which we just did previously, will let this property become contiguous and does not create an enclave. It does require the large-scale comprehensive plan and rezoning amendment, which are companion amendments moving forward. The application is consistent with the City of Punta Gorda Comprehensive Plan 2040 land use elements, meaning future land use, transportation, and intergovernmental coordination. The application is in order, has met the statutory requirements, and is consistent with the comprehensive plan, specifically future land use element 1.1.2.1 and 1.1.10.1, and transportation element policy 7.1.6.1 and 7.1.6.3, as those are further outlined in the staff report which has been submitted. Again, the large-scale comprehensive plan amendment and rezoning amendment is required and is moving forward at this time. The applicant will be required to address water wastewater services pursuant to Exhibit B to the proposed ordinance, which was attached to the ordinance, and it does outline that the developer and the applicant, either the applicant, developer, or property owner is responsible for the cost of any on-site improvement, off-site or on-site improvements regarding wastewater capacity. And development review approval is required prior to submitting any building construction plans. Development Review Committee recommended approval contingent upon the addressing of the utility expansion request, and Urban Design recommends approval contingent upon City Council approval of an agreement to provide water wastewater services. Again, any on-site or off-site improvements are at the cost of the developer or property owner, and Planning Commission recommended approval of the request. We're here with any questions.
Questions for Lisa? Lynn? You think when I asked the same question?
Just for the same sort of question, can the motion for approval include a stipulation that it must be done at the developer's expense?
This actually goes a little more in depth for the water wastewater expansion or the improvements that they have to provide in the comprehensive plan amendment and in the plan development amendment. This is just bringing the property into the city. This is just bringing the property into the city. The others have to do with any type of development and the rezoning.
So the answer is I don't have to include that in a motion if I make one?
You don't have to include it in a motion in these. We would include it with the conditions in the other two ordinances that are moving forward.
Okay. I'm not sure I'm clear on
Well,
that.
the applicant's here, so we'll let the applicant speak, and that may help us out.
For the record, Gary Bain with Southwest Engineering and Design, and I have been sworn, representing the applicant. And again, this is a voluntary annexation into the city. As part of this process, we will go through the future land use and then following the plan development afterwards. And it is, what we're seeking is an adult living facility followed by an independent care in the future, just so for reference. But we agree with staff's report and hope to be part of the city one day. Thank you.
A question. You have met with Steve Adams from the Utilities Department.
Correct.
I know that with discussion about the design of the wastewater facilities.
Good.
And have you worked any further with where that the lift station would be located around the Home Depot area?
Right now, the first approach was to see if there was capacity in lift station 63, which is the lift station right by Home Depot. Johnson Engineering, our sub-consultant, is redoing their report they did, the utility report that they did for you in the past. We've submitted 2 drafts to Steve already. We've just received further comments, so we're getting with our team this week as well. Hopefully address some of those, and maybe there might be some improvements made to that lift station, or find some other ways of looking at if there's capacity in that lift station to serve this project.
Okay. Thank you.
Further questions?
Other questions for the applicant or the applicant's representative? This is a public hearing. Anyone wishing to comment, please come to the podium, state your name and that you have been sworn, and you will have 3 minutes. This is a public hearing. Last call, this is a public hearing.
Motion to close the public hearing.
Second.
There's been a motion and a second to close the public hearing. All those in favor, please signify by saying aye.
Aye.
Aye. That motion carries unanimously.
I'll make a motion that we approve AX-02-19 as stated in the city staff report.
Second.
There's been a motion and a second to approve AX-02-19 as stated in the city's staff report. All those in favor, please signify by saying aye.
Aye.
Those opposed? Motion carries unanimously. Thought we weren't going to get a motion there. Okay.
I was trying to decide.
Well, and
I do think it needs to be,
if I might, I understand where you're going. And for the sake of clarification, Lisa, in the city's staff report, the recommended action was included providing that the city council provide direction to staff with regard to the utility issue. And also in the summary, in the last sentence of the last sentence of the second to last paragraph, says it's recommended that the developer be responsible for any and all on-site and off-site utility improvements that would be required to serve this property. I don't think it would be inappropriate if the city council decided that as part of the motion, that they would require that as a condition of the approval.
Okay.
So if you wanted to amend your motion, that would be appropriate.
I would like to amend my motion to include the stipulation that any wastewater improvements on that property include at the owner's expense.
I would also like to say, isn't it utility that you're talking about?
Any utility improvements, how's that? Was
I think
that
it's
cover it
utility.
more?
Is that right?
Well, I think both. I think
Water and
It's
it's
water
water and
and
sewer, so
Right, it's water and
on-site and
sewer.
off-site utility improvements.
Okay.
So that would include,
So all utility improvements?
yes.
Okay, so I would like to amend my motion to say that, that all utility improvements would be at the developer's expense.
Is that okay?
Can I just get some clarification? Is that our hydraulic share, or is it, how is that?
I would have to defer that to the utilities to what they are going to require. I don't know. I can't answer that question. I'd have to ask utilities to step in and answer that question.
What do you mean by a hydraulic share?
Well, because our, when we first approached the city, with the utility question, the wastewater, they were saying that the lift station was at full capacity. To do another lift station, estimates are coming in at $1.4 million, which would serve the whole entire community. We are 1% of that. Why would we pay for the entire thing? You know, so our applicant will like to know if that's what.
The recommendation that was adopted in the first motion is that the developer be responsible with respect to the utility improvements that would be required to serve this property. As Lisa mentioned initially, ultimately, this is going to need to be reviewed by staff for implementing the project beyond the annexation. And those details will determine what would be required for this project. But the motion that you've proposed as it relates to the annexation ensures that whatever improvements are required for this property would be paid for by the property owner.
So my amendment to my motion stands.
I think that it sounds like that you're covered.
Yeah, that's what I got.
Okay. Okay, so we need have an amendment, and do we have a second to the amendment? We have a second to the amendment. All those in favor of the amendment, please signify by saying aye.
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 Those opposed? The amendment carries unanimously. Or the motion for the amendment carries unanimously. Okay, then moving on, we'll move to CP-02-19.
Yes, this is the first reading of an ordinance which will read by title only. An ordinance of the City Council of the City of Punta Gorda, Florida, amending the City of Punta Gorda Comprehensive Plan Future Land Use Map to include newly annexed lands, amending the future land use map to reflect the change in the current designations of low-density residential/county to medium-density residential/city for 16.33 plus or minus acres, consisting of parcels of land addressed as 26150 Angelica Road and 26041 Cuneo Road, 26021 Cuneo Road, and being more particularly described in the boundary survey attached here to and incorporated herein as Exhibit A, providing for conflict and severability and providing an effective date.
Good morning, Lisa Hannon, zoning official, and I have been sworn. I'd like to enter the staff report in its entirety into the record by reference. Staff did receive and has processed the comprehensive plan future land use amendment, which is the companion amendment going along with the annexation of the properties at 26150 Angelica Road, 26021 Cuneo Road, and 26041 Cuneo Road. The properties, again, are currently vacant, but there are proposed development plans. The site is located behind the Burnt Store Presbyterian Church and south of Burnt Store Meadows. Again, this is the companion amendment to AX 03-19 in the city land use category required for development. The amendment request is for medium-density residential, 10 units per acre maximum, provides for other uses compatible to residential. The subject property, 16.33 acres, more or less, has 67 residential lots on the original plat. A pre-annexation agreement was approved by City Council, Resolution 3462-19, and will provide for a maximum entitlement of 100 dwelling units. Before you is the graph of how the density has been calculated. And the plan amendment will result in no increase in total number of dwelling units permitted upon the parcels owned by Burnt Store Presbyterian Church. This is consistent with the 2040 Comprehensive Plan, future land use element, coastal management, infrastructure, housing element, recreation, open space, transportation, public school facilities, intergovernmental coordination. The concurrency requirements, Burnt Store Road is a level of service D, and it currently operates at a level of service C, which is well above the standard. The requirements for potable water and wastewater. This property is outside the Punta Gorda utility service area and is not currently served with municipal or county water or sewer services. An agreement to provide water and wastewater service to the subject parcel development is dependent upon council consideration. And the currency requirements, again, for potable water, wastewater, the owner and developer is responsible to design on all on-site and off-site water and wastewater facilities, which may include upgrading existing off-site infrastructure. All utility construction plans, permits, and shop drawings must be reviewed and approved by the City of Punta Gorda Utility Department. Obtaining all necessary regulatory approvals, including Florida Department of Environmental Protection, City of Punta Gorda, Charlotte County, and Florida Department of Transportation. All off-site utility improvements must be contributed to the city as an asset prior to approval to place in service. Properties, to include both residential and non-residential, shall have separate meters and billing accounts for each. Utility service is contingent upon sufficient water and sewer plant capacity at time of connection, and the capacity is based on a first-come, first-served basis at the time of connection and impact fee payments. Stormwater and drainage will be reviewed at time of site development plans. Solid waste will be reviewed at time of site development plans. The same for parks and recreation and public schools. And no student generation is anticipated based on the currently proposed use of the property. The application is in order and has met statutory requirements. It is consistent with the 2040 comprehensive plan as outlined fully in the staff report, and a plan development rezoning amendment will be required prior to any development approval. Sufficient density dwelling units exist for the requested transfer. Applicant is required to address water and wastewater services pursuant to Exhibit B of the proposed ordinance. Development review approval is required prior to submitting for building construction permits. And Development Review Committee did recommend approval contingent upon the addressing of the utility expansion request. And Urban Design recommends approval contingent to the City Council approval of an agreement to provide water wastewater services. And Planning Commission recommended approval. And we'd also like that staff request council approval to transmit to the Department of Economic Opportunity for the comprehensive plan transmittal.
Questions for Lisa?
For the record, Gary Bain with Southwestern Engineering. I have been sworn. So this is the density that we are going to need in the future. When you look at the entire site development, plan development, we have an adult living facility which does not require density, but in the second phase of the project, which is in the south half portion, we're looking at doing 110 independent living facilities. So that's one of the reasons that we're requesting the density on site as part of this future comprehensive change. If you have any questions, I'm available. Thank you.
Questions for the applicant? Okay, then this is a public hearing. Anyone wishing to comment on CP-02-19, please come to the podium and you have 3 minutes. This is a public hearing. Please come to the podium if you wish to comment. Last call, this is a public hearing.
Motion to close the public hearing.
I never get to say it.
Well, we need a second.
Because she always looks that way
Okay.
first.
Did I jump? Oh, sorry.
We have a motion and a second to close the public hearing. All those in favor, please signify by saying aye.
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 Those opposed, the motion carries unanimously. So would somebody like to make a motion?
I can make a motion. I would make a motion to approve CP-02-19, once again with the stipulation that any utility improvements for the project be at the developer's expense.
And can you include that you approval to transmit to DEO?
Yes, thank you.
Thank you, ma'am.
There's been a motion and a second to approve what Lynn said. All those in favor, please signify by saying aye.
Aye.
Those opposed, motion carries unanimously. So we'll move to the last quasi-judicial public
Yes,
hearing.
this is PD-03-19, the first reading of an ordinance, which I'll read by title only. An ordinance of the City Council of the City of Punta Gorda, Florida, rezoning 16.33 plus or minus acres, being a portion of Section 33, Township 41 South, Range 23 East, more particularly described in the boundary survey attached here 2 and addressed as 26150 Angelica Drive, 26041 Cuneo Road, 26021 Cuneo Road, from its current Charlotte County zoning classification of residential single-family 5 units per acre / county to planned development neighborhood / city, providing for conflict and severability and providing an effective date.
Lisa Hannon, zoning official, and I have been sworn. I'd like to enter the staff report for this item, PD 0319, into the record in its entirety, into the record by reference. Staff has received and processed the planned development rezoning request for these properties. They are currently vacant and located behind the Burnt Store Presbyterian Church and south of Burnt Store Meadows. This is the companion amendment to the annexation and comprehensive plan amendment request. City zoning classification plan development is required for their development request. It is going to medium-density residential, 10 units per acre, and it provides for other uses that are compatible to residential. The residential density currently on the 16.33 acres that is being annexed in and rezoned for a planned development has 67 residential lots per the original plat. The pre-annexation agreement was approved by City Council per Resolution 3462-19. It provides a maximum entitlement of 100 dwelling units. Here is again the category, or the
Calculation.
the calculations for the density. Thank you. The plan amendment does not result in any increase in total density. It's just a reallocation of them over the properties. The planned development proposal is a multi-phase development. Phase 1 is a 96-bed assisted living facility with internal amenities and recreation facilities. Phase 2 is a residential development for a maximum of 100 dwelling units. It does require a planned development amendment when it comes back in, and which will be full public hearings again. Plan development approval criteria. It does comply with our comprehensive 2040 comprehensive plan. It's consistent with the following elements: future land use, coastal management, infrastructure, housing, recreation and open space, transportation, public school facilities, and intergovernmental coordination. And these are the surrounding zoning classifications and uses for the properties. Approval criteria: mitigation of adverse impacts. The landscaping requirements of any new development will serve to buffer the site and mitigate visual and auditory impacts. The property is outside the city utility service area. It's not currently served with municipal or county water or sewer services. An agreement to provide water and wastewater service to the subject property is dependent upon council consideration. The owner and developer will be responsible for all on-site or off-site water and wastewater facilities, which may include upgrading existing off-site infrastructure. All utility construction plans, permits, shop drawings must be reviewed and approved by the City of Punta Gorda Utility Department. Obtaining all necessary regulatory approvals, including Florida Department of Environmental Protection, City of Punta Gorda, Charlotte County, and Florida Department of Transportation. All off-site utilities must be contributed to the city as an asset prior to approval to place in service. Properties to include both residential and non-residential shall have separate meters and billing accounts for each. The service is contingent upon sufficient water and sewer plant capacity at the time of construction. Capacity is on a first-come, first-served basis at the time of connection, and impact fee payments. Utilities indicated that the property cannot be connected to the force main and burnt store. The lift station 63 is operating at capacity. New flows to lift station 63 will not be permitted. Assigning additional flows to lift station 63 will expose the city to Florida Department of Environmental Protection fines, FDEP consent order to require the city to cure the lift station 63 overcapacity issue. Accommodate anticipated traffic. Burnt Store Road is currently a level of service D, but operating at a level of service C, which is well above the standard. Preserve ecologically sensitive areas. There are 2 protected species that have been identified in their environmental survey, which is the red-cocketed woodpecker and gopher tortoises. For the bird, there's no evidence of nesting, but there have been some small woodpecker resembling the RCW was briefly observed. The species identification could not be determined, so consultation with Florida or Fish and Wildlife Services may be required. A 100% gopher tortoise survey and relocation permit from Florida Fish and Wildlife Conservation Commission will be required prior to development. Topographical, geological conditions, there's no known unfavorable conditions identified. Conceptual plan provides for an on-site stormwater management system. Approval criteria of noise attenuation measures. The proposed project is a 2-story building, a 3rd-floor central core, and on-site parking. Development plans do require approved landscape buffering that has to be maintained in perpetuity, and that should help address any noise attenuation. Architectural treatment and site planning. All planned developments are subject to architectural provisions, landscape standards, sign standards, parking and loading requirements, pedestrian bicycle facility requirements, and those will be addressed at time of development review when they submit for development plans. In conclusion, the applicant again is required to address water wastewater services pursuant to Exhibit B of the proposed ordinance. Development review approval is required prior to submitting for building construction plans, and all PD requirements reviewed at the time of development review. The DRC committee recommended approval contingent upon addressing utility expansion request. Planning Commission recommended approval, and Urban Design recommends approval contingent upon the City Council approval of an agreement to provide water and wastewater service.
Okay. Questions for Lisa? Lynn?
First, I would like to disclose that about a year or so ago, I met with the applicant on this project when it was in the very preliminary stages, and I wanted to put that on the record. I think that, again, we had an issue before this all started where there was something going on with regard to the airport overlay district and the, I forget what they called it, but.
The approach zone.
Thank you, the approach zone. And that has been resolved with the amendment we made to that overlay district?
Yes, ma'am.
Because that was, I know, an issue at one point. Okay, that was all I needed, thank you.
Yeah, that was an oversight, I think, on our.
Yes. Kind of a Scrivener's error on that.
Yes, it was.
Unintentional.
Yeah, and I have to say, I've had many meetings with the applicant, under full disclosure, because it is in my district, and they have come to me. I'm a member of the church, and they have come to me to seek out my consultation on the whole annexation issue. I've met with Mr. Bain and our utility staff in discussing utility issues and that kind of thing, so.
I met with them too.
Okay.
It was a while ago. It was at least
Yeah.
probably a year ago.
Yeah.
It was about a year ago.
Yeah, and
for
I've
the-
met with the developer as well, Mr. Mueller.
For the record, Gary Bain with Southwest Engineering, and I have been sworn. This is actually a first for me, going through annexation, comp plan, and a PD, and I already have my SWIFT permit for the site. That has never happened to me.
Wow.
That's how long this has been in the works, this project.
Yeah, it has.
Because you're right, we had the overlay, the RPZ zone was that language. So the developer at the time wanted to fast stream this thing, so we were designing as we were going through this whole entire process. So we, about a month ago, received our Water Management District permit. So like I said, this is the first for me. I've never had a permit prior to getting a PD before, but that's being said. I do have some, if you wanted to see what it's actually going to look like, because it is permitted through the Water Management District. Can I?
Sure.
While he's setting up, since you've already voted, I don't really have a problem with him showing you what it's going to look like. But as you know, in rezonings, You're supposed to make a decision based on what the best use of the property is going to be.
We didn't vote on this yet.
Oh, well then, wait until they vote before you show them what it's gonna look like. 'Cause looking at what the particular project is going to look like is not really appropriate in your decision for a rezoning.
Okay, so we want to see it, but we'll wait. We will take public comment, and then you can show us.
But the site plan is part of the PD process, isn't it not?
Yes, the site plan was included.
Yeah.
Okay.
Okay. So what we'll do is we will take public comment on this. Anyone wishing to comment, please come to the podium, state your name and that you've been sworn, and you have 3 minutes. This is a public hearing.
Motion to close public hearing.
I have to have one more
Second.
call.
Oh, I was so excited, I was gonna get
Hang
to
on,
do
wait a
it.
minute. I have to
You have
announce
to
it
say it
3
3
times.
times,
Say it 3
okay.
times.
You have to say it 3
She told me to
times.
say it.
So,
It's your fault.
okay. Last call. This is a public hearing. Go Debbie.
Motion to close public hearing.
There's been a motion.
Second.
And there's a second to close the public hearing. Those in favor, please signify by saying aye. Aye. Those opposed? Motion carries unanimously.
I'll make a motion to approve PB-03-19, again with the stipulation that utility improvements to the property be at the owner's expense.
Second.
There's been a motion and a second to approve PD-03-19 with the utility improvements to be at the owner's expense. All those in favor, please signify by saying aye.
Aye.
Aye. Those opposed? Motion carries unanimously. Okay, now, Gary.
Okay.
Thank-
Yes, given the fact that the public hearing has been closed, so this is not part of the public
2 or
hearing.
3 times.
So, as I mentioned before, this is where, this phase right here is where the adult living facility will be situated. We have 2 entrances, one coming off Burn Store and the other one coming off Cuneo. Towards the south end, that is the Phase 2 area of where the independent care facility would be. Just a quick look of figures that I've seen. This is some of the renderings of what it's going to look like. You have the 3 stories. It's a 2-story building with a 3-story corridor. I've been told that the 3rd story is more of a banquet-type facility where they can hold events and stuff for the church as well as for people around the area. And that's just another elevation view of the building itself. So I just wanted to give you a quick look what is coming down. Hopefully we could start construction by the summertime is what we're, if we could work out the lift station issues. But other than that, thank you very much. I appreciate your vote on this.
Thank you. Thanks for sharing that. Any questions about the project? Okay, so we have completed all of that, and we are ready to go into the consent agenda. I guess the question I have for the council members, do you need a break?
Yes,
Before we
please.
proceed?
That'd be good.
Okay, is it 5?
Yeah,
5
5.
minutes good enough? Okay, take 5. Thank you all. Come back at 10:47. Go ahead, go. think our microphones, there we go.
There you go.
City Council is now back in session, and the next on the agenda is our consent agenda. Would anyone like anything pulled from the consent agenda? Okay, seeing none, then we'll take citizens' comments on consent agenda items. And come to the podium, and you will have 3 minutes. We have the city clerk, approval of minutes, legal invoice, a finance department item, and 2 items from the urban design, and 1 public works item. Anyone wishing to comment, please come to the podium. Seeing none, then I'll take a motion.
Make a motion for approval.
There's been a motion and a second for approval of the consent agenda. All in favor, please signify by saying aye.
Aye.
Aye. Those opposed, motion carries unanimously. Okay, we will go to the regular agenda. And is it something, because we've got some people here that are realtors, that we could maybe move that item up to?
Yeah.
Council, are you in agreement with that? So we will move the item that is actually item 6A, unfinished business, continued discussion of signs in the right-of-way. We will move, hear that item right now, and then we'll go back to the rest of the agenda. So we will take citizen comments on this item only. So if you would like to come to the podium, you will have 3 minutes to comment on this item only.
Good morning, Council. My name is Bill Dryberg, and I'm the president of the Board of Realtors. Obviously, it's on the agenda. It's asked for discussion, so I don't have a lot to know what you're going to discuss. So we're going to, since our meeting 2 weeks ago, we're still waiting diligently for the city attorney to complete his work on the ordinance so that we, in turn, then can sit down and meet with him. But in turn, what's happened is that code compliance now is obviously citing the agents for their signs for sale, because we've kind of got past the open house signs. And that question, they're all over the place. So what I've been doing for the last 2 weeks is I've been going through the entire city measuring streets and intersections. So because what the ordinance says now and what it might say in the future, and again, hopefully we can address that with the city attorney, is we talk about right-of-way. Well, right-of-way is open for interpretation. As president of the Board of Realtors, my job also is to set speakers for our general monthly meeting. Our next meeting is April. I happened to call Paul Polk. I want him to come talk on this so the agents could see it. And I happened to mention to him that we're talking about using his GIS maps for where the property line is. And he said, "Oh my God, Bill, don't do that." That was, I'm paraphrasing, but that's roughly what he said. They're not correct, because he's got that disclaimer, and it says right in there, the disclaimer's in there. So what I was looking at then was to get with, when we meet with the city attorney, is to use something that's constant, and that's the street. When you look at the streets, not the sidewalks, the street back into the property is always the same. The way it was laid out, the city's pretty good about that. So if we put in a new ordinance that says 25 feet from the edge of the street up into the property, then that works for code compliance, it works also for the agents. So it's something to look at. So I've been looking at everything. Because the other thing you're gonna see, if you postponed the code compliance meetings, the one in April was set on these for sale signs. There's a sweet old lady out there, and she's so upset, trying to sell her house. The agent had put the sign way up in the property, close to the home, and she got upset by that. She said it was too far up, so she picked it up, and she moved it and put it down in the right-of-way. And of course, then the agent got cited for it, and she's all upset. She's gonna testify. And had I known what this was gonna come up today, I probably could have had her come in here and talk to y'all. So that's just one example of what happens out there with that particular thing. But I'm here, I'm letting you know, we're working diligently. I want to come up with something that when it comes back to city council, that it'd be right for you guys and be right for code compliance. It'd be right for our realtor community. So anyways, I'm here if you have any questions for me.
Thank you. The buzzer didn't, the 3 minutes left, but when it didn't sound, so I don't know why. But any other comments about this item? Okay, council members.
I have something.
Okay.
Okay. It has come to my attention that we have a definition problem in our city. And I think that at some point in time, you addressed this because the perception of a homeowner from other parts of the country is that their entire yard is their yard. Now, yes, they know there's an easement, but they don't consider that easement to be right-of-way. I had never heard of a part of my property being considered right-of-way until Monday when I was here for my agenda briefing, and I said, why are we picking up all these signs? And somebody said, well, they're in the right-of-way. So I believe that what we need to do, what I would like to suggest is that we put a moratorium on picking up all signs until we figure out what our vocabulary should be. Because I mow it, I weed it, I put my stuff there. To me, it's easement, it's not right-of-way. And I think if we're going to change the vocabulary, that everybody has right-of-way in their front yard, people need to know that because we don't know that right now. And I think our community is dealing with enough really big things right now that maybe a person's sign of a for sale sign in their front yard should not be top concern.
Lynn?
I agree with you, Debbie. I asked for this to be put back on the agenda even after Mr. Dryberg asked
I think there were
for it.
multiple people that
Yeah,
actually
I'm sure there
asked.
were. That was going to be the rest of my sentence. I'm sure there were other people as well. But I asked for it because I've been coming to council meetings for the better part of 18 or 20 years. And I remember when this ordinance was first put in place. And the real intent of the ordinance, when it first came about, was because of the open house signs and off-premise location signs and waypointing signs. It was not intended to be heavy-handed and pull realtors for sale signs on private properties. I think this is a horrible idea. I feel for you guys. I truly do. I'm really sorry that this is going on, and we need to fix it. Let's get this right. You guys have a job to do. We have a job to do. Let's do it and work together for the greater good. I think we should, not only a moratorium, we should not pull signs on private property, period. Nobody's going to be able to police, we are not going to be able to police every single realtor sign that's on a private property that's a for sale sign. We just can't do it. I've watched lawn guys come and pull signs when they mow the lawn, and then they throw it someplace or they move it someplace. We can't expect these guys to be going out 30 times a week to go and check where all their real estate signs are. We just can't. It's unreasonable. And I do think we need to redefine this. I mean, this is just not right. Just my opinion, but I think we need to really take a serious look at this. And in the meantime, until we get it right with the new ordinance, let's not enforce pulling signs on private property.
John, I think
Just
you have
a
something
quick
you'd like to say.
question first, though, is the new ordinance that's being worked on dealing with this issue that was just brought up?
Actually, to give you an update, there is a draft. It's a working draft, so it's not yet a public record available for dissemination that is being currently reviewed by staff. I'm waiting for their comments before we finalize the draft ordinance that's available for public comment. And I've attempted to address it in the best way I can to be consistent with the requirements of the state, of the Supreme Court's decision. And frankly, there still is a provision in there regarding signs within the right-of-way, because signs in the right-of-way pose problems not just as a matter of clutter, but for the city's obligations regarding the utilization of right-of-way. However, with respect to the unlimited number of signs, or not maybe unlimited number of signs, but the relaxation of our regulation of signs on private property outside the right-of-way, you'll find it to be hopefully an improvement over the current situation. With respect to if the city council ultimately decided to retain the protection of the city's right-of-way, and in recognition of the somewhat difficulty there might be in establishing exactly where the right-of-way is in the absence of a survey, I think we can still utilize the right-of-way as shown on the property appraiser's GIS map as the line for demarking where the right-of-way is, because that's readily available to not only the city for enforcement purposes, but for the property owner or anyone else wishing to put stuff in the right-of-way, or avoid putting stuff in the right-of-way. The property appraiser's GIS website has a caveat in there that the lines shown on the GIS are not the equivalent of a surveyed line for the purposes of establishing legal boundaries, and that's why it's there, because they don't want anybody to assume that they can rely on that instead of a survey. Nevertheless, they are fairly accurate in terms of identifying where the right-of-way is, because they're based on surveyed plats. And the GIS maps are not just put together willy-nilly, but do as good of a job as they can to be consistent with the right-of-way as shown on the map. So I think if we still use that for regulatory purposes, we're okay, if that's what the city council wishes to do. I don't have a problem if the city council wished there to be a different methodology. But then you come into, what is, if you were going to do 25 feet, for example, from the road.
That's the front of your house.
Some houses.
Some
Yes, and some no. In the cul-de-sac in which I live, across the street from me, there are 2 vacant lots, and the right-of-way is 9 feet. It's actually it's like about 9 feet. And so when I saw the for sale signs that are on those, I thought, are those in the right-of-way? And I actually went on to look, and they're set back about 10 or 11 feet. They're outside of the right-of-way. So if we use the 25-foot, it's not a standard. I realized that I know when I was putting out political signs, I used 25 feet as a guideline for myself.
From the center of the road.
That is true. It's from the center of the road.
It's not from the edge of the street.
Right, it's from the center of the road.
25 feet in Punta Gorda Isles and Bird Store Isles is the front of your house.
Okay. I'm not suggesting any solution at the moment. I'm suggesting that we have an opportunity to address it when we have the ordinance for your consideration. I personally feel, just from the standpoint of having to enforce the ordinance, if we are going to maintain the city's desire to protect the utilization of its right-of-way, then there's a way to make everyone aware of what the line is going to be for the purposes of that enforcement, without necessarily establishing that that is the surveyed right-of-way line. And so that is an option for your consideration. It's equally an option for your consideration to eliminate the provisions that provide for a prohibition about putting signs in the right-of-way. I mean, that's obviously an option available to you.
But is it all or nothing? I mean, do we have to call that space in front of my home that I maintain, and my car drives over it and whatever, do we have to call that right-of-way?
Well,
Can we not call it an easement?
what is the right-of-way is an issue that is totally unrelated to signage. The right-of-way is for subdivisions is platted because that's where the developer indicated the city's rights for utilities, for road construction and maintenance. Drainage, all that exists. And we can't do anything about that without redoing all of the plans. I mean, there's, without trying to confuse the issue, technically, everyone who has property within platted subdivisions in the city owns to the center line of the road, the platted road, technically. However, that portion of the property that's impressed with or within the right-of-way is subject to essentially an easement for the benefit of the city. A right-of-way is essentially an easement. It's just a particular type of easement. And so when the road, for example, is vacated, then that easement is removed and the ownership is recognized again to the center line. So, you know, I don't want to really get into semantics as to easement, right-of-way, or what have you, but the platted subdivisions set forth where the right-of-way is and where the city has the authority to put in the improvements that they need for municipal purposes. Which is why a few years ago, when we put the burden on the property owner to mow the area adjacent to their property within the right-of-way, the determination was made and recognition was made that that is area that actually is owned by the upland, the property owner. So.
John?
It seems like with all those terms, we're just getting further away from getting a solution, but can you use a simple example of a number of feet from the center of the road to somewhere that would solve it all, and then and that would be clear?
Well, yes and no, because first of all, and I'll address the safety issue. You don't want people standing in a road and doing a measurement in order to determine where to put an open for sale sign, number one.
Well,
number two, where the road is doesn't necessarily indicate where the paved portion of the road is, doesn't necessarily indicate that it's actually the center of the right-of-way, because the roads oftentimes don't extend within the whole area that's identified for road purposes until the city expands it.
But then why not go take the edge of the road and go so many feet?
And those are all possibilities.
That's something we just need to discuss.
Exactly, exactly.
Which is what
And I would agree with Bill that we need to just, and I think that's what I'm hearing, we all want in this new code is specific language that everybody can agree to, that it's clear and understandable, and, you know, our situation's going to exist where somebody moves the sign into the right-of-way, yes. Are we going to, you know, but because of other issues that we've talked about time after time after time, about signage in the right-of-way, and, you know, we have to.
The code can be written any way you wish to write it. You can write the code so that we don't have a problem with any signs in the right-of-way. So this whole issue would go away if that's what the city council wants to do. But the code that we currently have was adopted by a city council that wanted to limit, if not exclude, most signs from the right-of-way. It's an opportunity for you to change that philosophy.
Okay, just so we're clear, because I'm really confused. Is it possible for us to allow private residential property owners to have a for sale sign out near the road in front of their house?
Yes, it is possible.
And it would be legal.
We can write not presently, but we can write the ordinance to do
But
that.
it could be legal to do that just on residential lots.
Absolutely.
But it would not be just for sale signs.
That's correct.
It could be any sign. You
But-
cannot
but-
restrict content.
I understand that, but real estate signs are size specific.
Well, we're going to change that too. To give you kind of, again, the draft that's presently being discussed is intended to be content neutral. There's a distinction between signs that are going to go within residentially zoned property and those that are going to go in commercially zoned property. So I'll confine myself to the residentially zoned property because that's the topic of discussion. The proposal is that there be a set square footage of signage of any nature that's permissible on residential property. And somebody can have as many signs as they want, of whatever size, as long as the cumulative amount of area of signage doesn't exceed that, that maximum. That way, we're not regulating signs on the basis of its content. We're just regulating signs with respect to how much area clutter, sign clutter. And that's, you know, that's the best we can do, given the parameters that the Supreme Court has given to us.
So based on the comments that have just been made by at least 4 of us, can we, at this point in time today, say that we would stop pulling residential for sale signs?
Well, I'll leave it to the city manager, but I think if you specify, right now, our ordinance prohibits signs within the right-of-way.
I understand that.
Okay, if you were to tell the city that they are to pull all signs but residential for sale signs from the right-of-way, that would be a content-based directive. You can do that. The city might be able to get away with that, but that also creates a constitutional liability if we follow that directive.
Howard, how many signs are we pulling that are non-real estate signs right now?
Do we have any updates? I mean, we don't.
Lisa Hanna, zoning official. I don't have an update on the signs that were going before the code board for March, which aren't now. I think there were 2 or 3 that weren't real estate signs. And I don't know.
Mostly a real estate.
And how
They
many
are
were real
most-
estate? Do you remember the number?
I think we had 30 cases on the code board for March, and all but 4 cases were for signs. So that's 26, and take away 3 for like just snipe signs that were in the right of way that we picked up advertising something else. Probably about 25, maybe 23, 25. So.
Again, we've been instructed that when we deal with code compliance and signage, we do not deal with content.
I understand that.
So, what would you like us to do?
I think we've been very generous in what we're doing for the realtors at the moment. And I think I think working out some very clear language that we can all find easy to understand and work, as Bill suggested, is a great idea with us going forward. I don't know that I'm in favor of relaxing the code. John?
I'm not either necessarily in favor of relaxing codes at the moment, especially if we're momentarily going to see a new ordinance, a set of ordinances.
Because of what happened this past week, as a staff, we haven't really concentrated on this. We will get back to it. And what we normally do is we take a draft ordinance, staff, we meet as a staff. When we're ready, we bring it to you before we even bring it to the Planning Commission. So we will give you a draft of the new revised sign ordinance before it even gets to the Planning Commission for you to review and comment. And then we get it to the Planning Commission.
When are we going to have an ordinance to look at?
Well, we were trying to restrict the April 1st agenda,
Do it there.
about April 15th.
Can we agree to not pull the real estate signs until that time? I just think this is very heavy-handed.
Well, we can agree not to pull any signs until that time. That would be my recommendation.
How many years has this sign ordinance been in place?
2010, I think, was the last version.
But how many years have we not allowed real estate signs in the right-of-way?
Longer than that.
Yeah, and every jurisdiction prohibits signs in the right of way.
So our code, current code is no different than other jurisdictions, is what you're telling me.
I have not found one that allows signs in the right-of-way,
And
unless it's for a special event, you know, the special permit or whatever that they get permission from the
So
city.
it's like, so to me, it's like, this is something that everyone kind of knows. Can things accidentally get there? Yeah. Can it, you know, some unintentional things do happen, and I understand that, but I feel like our code it's been there for so long. Realtors, they know this. Jaha?
One thing I think probably the case in this case is that we don't know what the right of way is, and I think that's the issue, is that that's unclear. And unless, so I think it's difficult to enforce if we don't really have a clear definition of where that lies.
And it's subjective on the part of the code officer.
Well, and that piece I can agree with. I mean, when we, you know, have the understanding that when you're inside of the sidewalk, that you are not in the right-of-way, but then all of a sudden you find a nuance where on a particular property, gotcha, because it's like there's just a little bit of the right-of-way that's inside the sidewalk. It's like,
Well, that's if you're lucky enough to live in an area with a sidewalk. I don't happen to be lucky
well, I
enough
don't
to
have a
do that.
sidewalk either.
So, I mean,
But I'm just saying, it's, you know, we're not trying to play gotcha here.
I don't like it.
So what's your,
What can we do that would be allowable so we're not being punitive at this moment?
Well, right now, you've directed staff not to enforce the current sign code on Saturdays, Sundays, or holidays. And so that would indicate that any sign that is out there in the right-of-way as shown by the property appraiser, because that's how code enforcement operates, would be outside of that relaxation. So you can either maintain your current direction or give new direction, which might include that we're not going to pick up any signs wherever they might be located.
Can we limit it to residential?
Well, we can limit, yes, I mean, you can limit the moratorium, as it were, on enforcement to just the residentially zoned properties, meaning that if we find signs in the right-of-way within commercially zoned properties, we can pick those up as usual.
That sounds good.
That makes sense.
You know, I don't understand what everybody's afraid of with signs. I don't understand. It's like you say, you know, for years we've had this rule about signs. Well, who cares? It's not meeting the needs of our community right now. And we have to address it. Really, what are we afraid of? What's this big bad thing that's going to happen if we allow people to put their for sale signs in their easement in their front yard? What's the bad thing that's going to happen? It's not like everybody in Byrne Store Isles has a house for sale.
I've been here 15 years, and city councils, the past city councils have been very consistent that whoever was on council regarding sign clutter and comments from the community, primarily, not always, but in many instances, the special residential overlay districts, about signage occurring in the right-of-way, in the drainage areas, and the city needs to make sure that the signage does not appear in those areas, reducing the amount of sign clutter, appearance-wise. And the council members would get comments from the community, again, a lot of it in the special residential overlay district. If the philosophy is changing If the climate is changing, fine. It certainly would make it a lot easier for our code compliance staff if we just said signage can be allowed in the right-of-way. We don't have to deal with it. However, that has not been what the community over the past 15 years has wanted, based on the meetings and the comments that we've heard from the community. If it's changed, fine. That's not what we've heard.
I'm not in favor of signs in the right-of-way. I said you drive down the street and you see all these signs, and that you cannot restrict what signs they are. So it's, now you're gonna all of a sudden see all these signs.
I mean, maybe a little recent history would start to get us closer to something. I mean, this came up at council, that we had too many showing signs, the real estate open house signs in the community. And I recall Lynn saying there were 17 down a road. And that's what we were trying to impact at the time.
Right.
Now, because we can't discriminate with what's on the sign, then everything else gets bound into this too. If we have a solution from the realtors to control those kinds of signs, and I thought the proposal I heard last meeting, and we're still working on it, made a lot of sense. There'd be one sign for a certain turn, and then if it was another one further down, you'd do that one too. But every realtor wouldn't have the same or bring out their own sign. For that reason, we need to solve that problem. We need to update the ordinance, but we don't want to get rid of what we had because it has worked. Now, we could say that as we implemented this, we went to the weekend pickup, and that caused a slightly different set of issues. And then the people picking up on the weekends may have treated the signs differently than those picking up during the week, and that caused a little bit more discussion. You don't know what all went into the, you could have one person that's very vigilant about picking up signs, and that could impact, he's trying to do his job or her job. But so the reason we're here talking about this today is because we said 3 weeks ago or 4 weeks ago that we had a real problem with these open house signs, and that was it. And so we got to solve that, and then we got to relook at the ordinance. I think come up with a distance from the street, whatever that is.
So we could state today that we could use the, whatever is on the property appraiser's website, right or wrong, but we could use that and make sure the realtors all know that that's what is to be used. And then
The problem still exists that signs are getting moved by contractors, and that's a problem. And it creates a huge problem for the realtors that are trying to sell those homes for people. And it's, I mean, this is not a simple solution, I understand, but I just think we've been very heavy-handed by pulling real estate for sale signs on private property. I have a real problem with that. If I was selling my house, I'd be really, really upset. It's just, we already limit the size of what the signs are. Lisa, how many of those hearings that are coming up on the Code Enforcement Board, you said 25 or so are real estate signs?
That is
And
correct,
what are
to
the
my
oth-
knowledge.
What are the other 3 or 4 signs that
They were like the Suncoast Truck Driving School and boat
But
storage.
not on
or some-
residential properties?
Some of them are. I don't know. I would have to go. I don't know what the address
Probably in
was or the right-of-way was, but yes, it could have been in residential property. But I don't know. I don't have the information in front of me.
I'm of the opinion that I think we should allow the signs to stay for right now until the ordinance is reviewed. And on residential properties. I'm specifically talking about residential properties.
Developed and undeveloped.
Yes,
I'm agreeable with that.
until we work it out with the ordinance.
Is it every day of the week or just the weekends, or how do you want to?
Every day of the week for right now. It's only gonna be a few weeks that we're gonna be reviewing an ordinance, hopefully.
Well, it may be a few weeks before the city council reviews the draft. But then, once you've approved the draft, it has to go through the planning commission. and
Understand.
So it may be,
And by then, we'll know if there's a lot of abuse going on.
I'm just looking for direction.
Yeah, and I mean, we can always, if we do see abuse taking place, then we readdress it. I'm trying to be reasonable and fair.
Well, I think that we all are trying to be reasonable and fair. The way I look at it is every corporation has rules. And if you don't have rules, then you don't have any kind of decorum. And these rules have been in place for years. This is not new. And the fact that a sign could get moved is not new.
But we really weren't pulling residential for sale signs very much.
Yes, we have.
Not that much, not like what we're doing now.
We've never had this many.
That's because at the direction of city council, we decided to have some code officers working on weekends, where a lot of this occurred. But we've been pulling signs during the week all the time. But the weekends is when we really clamp down, and holidays.
Well, the perception, the emails that I'm getting, the perception is that since we aren't letting them pull them on the weekends, they've decided to double down during the week. That's the perception that is out there.
Well, maybe we should have.
Because there are a lot more, they feel that there are a lot more signs getting pulled during the week from residential properties than have ever been pulled. And I think, when is the last time we had 25 at a?
Those were all on the weekend, I think.
No, we've got them now.
No, they weren't pulling them on the weekends because they weren't working on the week.
Okay,
But the code cases are, the ones that are being in front of the code board primarily stem from us, our code officers going out on Saturday or Sunday, finding the signs, sending the letters, telling people to go to the code board.
And just to be clear, staff is not going onto private property to pull signs. They're pulling signs from the right-of-way, which is property within the control of the city of Punta Gorda.
I can tell you, having sat on the code board for a couple of years before I got on council, I don't ever remember a real estate sign being a code issue. And it was never on a code agenda, to the best of my recollection.
We're looking at it differently than we did.
Yeah, Bill, if you want to comment. That's an interesting observation. Why would we have realtors all of a sudden now then breaking our rule, or,
Bill Driver,
violating the rules?
Bill Driver again, President of the Board of Realtors. Two things. One is that the ones that are due for the hearing in March and also in April were the ones that were on weekend. The hearing after that are the ones that were picked up during the week, and there was a lot of them. I've been the legislative chairman for the Board of Realtors for 14 years. Not one phone call from one broker or one agent in those 14 years up until now has been made to me about signs being picked up, for sale signs for sure. Now, open house signs, we've been dealing with that with 2007, as I explained before. But for sale signs, this is the first time I've ever had them picked up.
Exactly.
So what do you feel has
What's
caused that?
different?
What's different now?
Well, obviously.
I'm being told it's not different because of our code policies. So what's different about
Well,
it?
the code enforcement people, the Women Council of Realtors had one of the code compliance officers at their last meeting this past week, and he's just doing his job, and I understand that. So he's obviously been directed to go out there whenever they're on duty and look for those things. Now, in all fairness, and I always will be honest with you, after that happened, when they got picking up the for sale signs by the realtors, I drove around then through all three of the sections, and I did see some that were in the right of way. But whether the realtor put them there, or the lawn guy put them there, or the homeowner put them there, I don't know, but I did see them. But yeah, they're realtors now for the first time, and I hate to use that, but as far as I can tell, for 14 years. The for sale signs are the ones that are being ticketed now.
I think until we make our final ordinance that we should stop. We should be.
On residential
Yes,
property.
yes.
That's my opinion, too.
Is there a third council member that has that opinion? Because if there is, we'll.
Yeah, that's what I said at the very beginning. I haven't changed my mind.
Well, there's three. So.
Okay.
then
Should we?
I think
Do we need a
a motion, please.
I will make a motion that until such time as the sign ordinance has been revised and approved by city council, we do not pull residential for sale signs.
Just signs within
Signs.
residential.
Signs on residential lots,
Second.
In the right of, well,
in the right of way and otherwise.
so there's been a motion and a second as to what Lynn said. We will not pull signs in the residential lots in the right of way.
Yep.
Now,
And otherwise.
and to be clear, when you said pull, you basically meant that we will not be enforcing the sign code as relates to signs
Okay.
within
Yeah.
residential
You want to
zoned
change it to,
property.
What he said.
What he said.
okay.
Yes.
Are you okay with that?
Yes.
As a second?
Yes.
So all in favor of the motion, please signify by saying aye.
Aye.
Those opposed?
No.
Aye. So there's 3-2.
Okay, so that makes very clear to our code staff now what to do.
So we want to see that code stuff quickly.
Please,
Okay.
before it gets really bad.
Okay.
Well, again, we'll try and earmark it for the 15th.
Okay,
And we need the realtors to be involved with the others.
absolutely. Realtors need to be involved. So,
As soon as we have a draft that's available to be discussed by city council, that will be a public record. And so the regulated community can be here at that city council meeting to let their opinions be heard as well.
okay. Great. Okay, we're going to move on in the agenda then. I think we all have our, you know where we're headed with that, so thank you. We'll go back to our regular agenda. We have 5 items on the regular agenda, and we will take citizens' comments on these items. It's award of agreement to pavement maintenance for the construction of the Harbor Walk West Phase 2, award of a master agreement and specific authorization for professional services. It's a Charlotte Harbor, or a coastal and, yeah, it's a SHNEP program. An appropriation of funds for endpoint protection software, an appropriation of funds for archiving software, and a preliminary discussion of the 1% local option sales tax programs. Anyone wishing to comment, please come to the podium. You have 3 minutes.
We've lost our non-staff.
There's nobody
Seeing that
here.
there's no one in, well, there is one person. We have Dan from the Charlotte Sun. So Dan, if you want to come and comment, you have 3 minutes.
Here's your
We've lost
chance.
everybody.
Okay, so we will proceed into our budget.
They've all gone home to self-quarantine.
Yeah, everybody is self.
Lost them all.
Oh, gosh.
Sorry, you gotta have some sense of humor in all
We do,
this.
we do.
Okay,
So we'll
good
say
one.
out there, we're going to move into the regular agenda now. Okay.
Good morning, Julie Rogan, Sutter Procurement, for the record. I'm here to, for the agreement award to Pavement Maintenance LLC of Fort Myers, Florida, for construction of Harbor Walk West Phase 2, Harbor Walk only. Procurement issued an invitation to bid for construction of Harbor Walk West Phase 2, which is construction of a multi-use pathway and sidewalk connections to the city's existing site amenities. Solicitation notices were sent to 464 vendors, and 25 viewed the solicitation online, and the city received 4 responses. The total lump sum cost, base bid for this project is $1,080,000. Staff is also requesting
to approve additional funds in the amount of $8,000 for permits and a 10% contingency budget of $108,000. The total overall project cost, including previous expenditures and professional service fees, is $1,333,662. Contingency budgets shall be utilized by the department for approved written change orders for unforeseen construction conflicts or amendments to plans. The project timeline for completion is 180 consecutive calendar days after issuance of a notice to proceed. Staff recommends award of this agreement to Pavement Maintenance LLC of Florida as being the lowest responsive and responsible bidder.
Any questions? Does anyone like to make a motion?
Motion for approval.
There's been a motion and a second for award of the agreement to pavement maintenance. All in favor, please signify by saying aye. Aye.
Aye.
Those opposed? Motion carries unanimously.
Thank you.
We'll move on to our next one.
Good morning, Ann Heinen, Procurement. This is award of a master agreement and specific authorization number 1 for professional services to develop the Charlotte Harbor Flatwoods Strategic Hydrological Restoration Planning Tool and Report to Water Science Associates of Fort Myers, Florida. The total budget or the total project cost is $568,255. Procurement received a request from the department to issue a request for qualification for firms with expertise in hydrological monitoring, modeling, and restoration planning to develop the Charlotte Harbor Flatwoods Strategic Hydrological Restoration Plan. Procurement did receive 3 submittal packages from firms. One firm was deemed non-responsive for not submitting all material components requested in the solicitation. The first evaluation and selection committee meeting was held on January 30th. The remaining 2 firms were ranked. The top-ranked firm was Water Science Associates, and Tetra Tech was the second-ranked firm. During that meeting, the ESC committee also determined that they will interview the top 2 firms. They selected criteria to interview the firms and weights. After the invitations were sent to the top 2 firms, the second-ranked firm declined the interviews and withdrew their response. The ESC committee reconvened on February 5th and finalized the evaluation process and agreed to enter into negotiations with the top-ranked firm, Water Science Associates, to proceed into negotiations for the master agreement and specific authorization number 1. The timeline for the project is 29 months. There is grant funding from 2 different agencies for the project. The first agency is the Florida Department of Environmental Protection, which we refer to them as the FDEP. And there is also a portion of the project that is being funded from the Southwest Florida Water Management District, which we refer to them as WIFMUD in our acronyms. The FDEP is also providing a contingency budget of $41,254 upon their approval for use of those funds. The master agreement will be for a period of 3 years, and the hourly rates will be fixed for a period of 1 year.
Any questions?
To David. Yeah.
Is there a motion?
Motion for approval.
Second.
There's been a motion and a second to approve the award of master agreement and specific authorization number 1. All those in favor, please signify by saying aye.
Aye.
Aye. Those opposed? Motion carries unanimously.
Thank you.
Might want to mention it.
I'll do it at the end. Brad?
Brad Schutte, IT Manager. The next item up on the agenda is for appropriation of funds for are replacing our endpoint protection software. We're currently using a software package that's been in use for several years, and technology has advanced quite a bit. And with some of the latest issues that we've had to face and other cities have had to face, we've decided to go to a product that offers us a broader base of protection, as well as the name of the product is Carbon Black TDR, and the TDR is threat detection and restoration. And that threat detection is something we don't have right now, and it allows the endpoint software to monitor our everyday usage and actually pick out anomalies that occur that we wouldn't normally see just using logs or using other software packages, the current software package that we use. The cost is a little bit more than what we're currently paying, but we did have money left over from last year that we put back into our reserve, and that's what we're asking for now, is an appropriation from those funds, in addition to the money that we have set aside for our existing tool to cover the cost. This will be an annual cost, so it will raise our operating a little bit as we go on into future years, but we feel that the protection it gives the city's data is very, very much worth it.
Questions? Lynn?
Why was this not included in our budget for this fiscal year?
At the time that we made the budget, which was none of the ransomware attacks had happened inside Florida yet. The security hadn't been as extensive an issue. And to tell you the truth, this piece of software hadn't made it to our radar yet because we had been focusing in other areas. After the number of attacks that occurred late last year, we realized that we needed to do something. And so when we saw that we had the funds that we put back into reserve, we started the motions to appropriate those funds to improve the package we have, rather than just stick it out with the one that we're currently using for another year.
I understand that things change a lot with IT. I get that. And I understand that things have to be fluid all the time. But, when we have things of this kind of expense, and it's this item and the next agenda item, it's just a little concerning that you have to find money in your budget, or we have to borrow money from another fund or something if we're going to pay for these things. And I've had a couple of citizens ask me the question, so.
Yes, and sometimes, because we have to budget so far in advance, sometimes it's hard to focus on everything that's going to come up that is going to need to be changed out. And when we bring requests like this to council, we realize that there's a choice in front of us. We can fund this unexpected increase to improve the quality of the product that we're currently using, or make the decision to push it off another year. And this one we feel is important enough to bring forward for your consideration.
Yeah, that was my question as well, was about the timing of this and in our overall planning process. So,
Kristen Simeone for Finance. I just want to point out too that these are savings that they did have some money left over, but we did not include them as reappropriations because they weren't already projects in their budget. So it is from other operational savings or some other capital projects that may have come in under budget out of their division. So I did want to point that out as well.
okay. So I can understand that, well, we have to talk about this one, but can we talk about both together, or can we?
Whatever is your preference.
Well,
You can do both at the same time if you want.
I guess, so the question, I can understand like the protection software and those kinds of things happen, like, they're continuously being updated.
Yes.
But the archival software, that's something like, isn't that something we would be planning on?
Well, the archive is a little bit of a different story. The archive software that we're looking to purchase, 2 years ago, we purchased a solution that the vendor had made indications that their solution was exactly what we needed, would do everything we wanted it to do. And over the course of the 2 years, we've been working hard with the vendor to try and get it to work, and it has not worked. So we started looking for alternatives. Our archiving is a big issue because our storage capacity right now on our main storage area network, our SAN, is about 88%. Optimal operating a capacity would want us to be closer to 70%. What the archiving software does is allows us to identify large files and, well, any kind of file actually within our storage that has not been touched in 2 years. And also helps us remove duplications and versions. It does versioning of software. That's what we were looking for the solution to do, and it proved not capable of doing it. So we found an alternative solution that it does. This one doesn't require a little bit of a cost up front, but then the maintenance is actually $4,000 a year less than the tool that we were currently trying to work with. So the archiving tool is going to allow us to protect that older data, keep it available for access, but allow us to put it off onto storage that's significantly cheaper than keeping it on our high-end SAN, the expensive storage that we use to run our daily business. And this is a solution that we've actually we have tried it. It does do what we expect it to do, and we're very pleased with what it's going to be able to bring.
So the question I have is in this industry, are you in contact with other governmental entities
Yes.
or whatever where you can find out, yeah, it's really working someplace so that we don't, get into a situation like what you just experienced?
Yes, absolutely. We're members of the Florida Local Government Information Services Association, which is all of the IT shops from all of the municipalities and special districts and counties in the state. We communicate with them. This was a tool that had come to us recommended. I think that what it turned out was that we wanted to do more with it than others are using it for. And when we talked with the vendor, they had given us assurances that it was going to be able to, and they've just fallen short in their ability to do that. So yes, we do. We generally vet everything that we move on with the FLGISA and with other organizations before we make a move on it. So this wasn't one that had any red flags against it. It's just we tried to push it to its limits, and it didn't come through.
Okay. Lynn, did you have a question?
Not a question necessarily, it's just a statement. If we're that close to being that full, we should have had this in this year's budget. And it concerns me that we're doing this retroactively because this could have been budgeted so that we understood upfront that this was going to happen for this year's fiscal budget. And I think we need to be more proactive going forward. If you're going to need other software programs or things of this type for your budget for next fiscal year, it needs to be included when we approve a budget. I just don't want to see us being behind the 8 ball on some of this stuff.
And that is absolutely, and that's our main goal. Unfortunately, we always have more projects than our budget can fund when we move forward, and we've always presented, I understand, and we've presented those, and that's where sometimes we have projects that fall into an unfunded list, and then if we have discretionary funds left at the end of we'll approach finance, as Kristen said, and say, we've saved money here, can we use that to do this that we couldn't fund this fiscal year, rather than push it forward a whole year.
It might also be helpful if you can let us know when you have these agenda items that maybe, as an example, we talked to the folks in Northport and they're using this software and it's been very effective for them, and maybe give us something that we can relate to. I think that could be helpful. It could make our decisions a little easier with some of this stuff.
Absolutely.
That's just my opinion.
Okay. Any other comments?
We will do that.
So let's go back to.
Agree with that,
Yeah. Let's go, good comments. Let's go back to the item C, Carbon Black TDR endpoint protection software.
I move approval for the appropriation of funds to purchase Carbon Black TDR endpoint protection software.
There's been a motion and a second to appropriate the funds for this. All those in favor, please signify by saying aye.
Aye.
Those opposed? Motion carries unanimously. Okay, now item D, appropriation of funds for purchase of Metalogix archiving software.
Move approval of appropriation of funds for purchase of Metalogic archiving software.
Second.
There's been a motion and a second for the appropriation of funds for the purchase of the Metalogic archiving software. All those in favor, please signify by saying aye.
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 Those opposed? Motion carries unanimously. Thank you for the discussion, Brett.
Thank you, Council.
Yes. Okay. Preliminary discussion of 1% local option sales tax extension projects.
Melissa Reichert, Communications Manager. As most of you are well aware, we put together a committee, the City Council did, about last July, of residents representing various segments of our community. They met over the course of the last few months and have come up with a recommended list of projects for you. They put a lot of time and consideration and thought into these projects, but the whole while, they knew that the ultimate decision on the projects was up to City Council. So what I have today is just an overview of their recommendations. I don't expect you to make any formal decisions today, but just to kind of start to understand the projects and start your discussion amongst yourselves. The first project that I have here is a almost $5.5 million project, public safety building expansion. That was one that the committee pulled out from the rest of the projects and said, this is very important to us. We want to see this fully funded.
I have a question on this one.
Certainly.
So it's my understanding that we can potentially use some impact fees for this. It would not necessarily be totally funded by the local option sales tax?
That is correct. Now, Kristen ran an analysis for me yesterday, and she used the full value of the study that had been done, and that was at $1.8 million. That's probably really unrealistic given the current times in the economy and our uncertainty right now. So we're probably looking at more like $1 million that would be available from that fund. Over the course of 6 years, it's going to take us 6 years to accumulate that $1 million.
Would we use that for that, or that's just an
Yes.
option?
Oh, yeah. You can, if you want, use impact fees for this project.
So if we did that, then we'd have $1 million to assign to something else.
Yes.
Yeah, I think that's important, very important.
Yes. Yes, you would.
In fact, it's important for any of our projects if we have. Okay.
The ADA transition plan, that was another one that the committee had pulled out as very important. They recommended funding that at $750,000, and those are projects that are citywide to bring us into compliance with both state and federal law for ADA. Any questions on this one? Capital project management, those are the funds to allow us to have someone or contract with someone to manage projects. The committee recommended funding of $540,000 for that item.
If I can just make a comment, not necessarily about this, but Debbie, since you represented us on this committee, if you have any insight into the committee's discussion that you wish to also share,
Oh,
it would
okay.
be great.
I didn't know
You to
if I
kind of
was-
give us that.
Okay.
Yes, definitely, Debbie, feel free, Councilman Carey, Member Carey, jump in at any time. Complete Streets US 17 improvements, the committee recommended funding at $500,000, and that also was a staff recommended level of funding. The total project budget is $3 million, but there could potentially be other funds available from outside sources that could fund that project. Historic District infrastructure, the committee thought this was important and recommended funding in both Tier 1 and Tier 2. This is the complete project that was presented to council, I believe, October, November timeframe of last year. And this is one that certainly has aspects to it that could be phased over time. Bayfront Activity Center.
Melissa, can I just?
Sure.
say one thing? One of the things that because I was a silent participant, one of the things that they looked at was that we read all of the regions of the the city included in the expenditures. And this was real important to them that this go forward.
Okay.
That this area of the city go forward.
Yes, this one, this plan.
The Bayfront Activity Center Committee recommended the full funding of $331,000. And when you see, I'm just gonna point out on this particular slide, you'll see on the right side, project initial ranking. So those are when they went through and they used a set of criteria that you approved to rank the projects. Based just solely on those criteria, that's where the project ranked. But then at our next session, we put the human element and the thought element into it, and that's why you're seeing the projects in the order that they are today. The project ranking was one guide to get to their decisions. E.C. Freeman House Assessment and Renovations, this would be the historic building evaluation, correcting building issues. The committee recommended funding of $200,000 for that. Historic City Hall improvements, the committee recommended $1.485 million. We had a little bit of discussion about if some of this work could be phased, and I think we're still the short answer is yes, but we're unclear as to what that could be at this time. And more information will be developing on that.
When do we expect our consultant to have the information?
I thought it was April.
April 15th?
April 15th.
Because, feedback I got from some residents was if we need to move money anywhere, they felt like this is an asset of our community we cannot ignore. And that this, whatever we have to do to preserve this building needs to be funded. And that was the feedback I received.
And not ranking number 25.
Yes. Yeah, so if we, have to take $1 million in impact fee for something else, and if there are park impact fees and whatever other impact fees can be used to scrounge up dollars to put toward this.
Well, I think Melissa will agree with me on this, that there was a lot of dissatisfaction among the members of the committee with the way they were being asked to rank. They didn't feel like the questions adequately covered what they, don't you agree with me? I mean, we heard this.
Which is absolutely correct. That's exactly why we ended up, we started at the beginning with a plan that the last couple of meetings, or it ended up only needing to be one meeting, were going to be where we fully discussed the project and we allowed other things other than that ranking to shape our decision. Those were just items to basically understand the projects better. So because they had to score each of those areas, they got to understand the projects.
But they were also very surprised when the final rankings were presented to them, that some of the things that were near and dear were 25. City Hall was really,
right.
That was one of the things that they really looked to find money to put there. And 25 is really not, I wouldn't even look at those if I were.
No.
The feedback I received from the person that I had nominated from District 5 said it was a very, very much a learning process, a great learning process.
So was the counties.
Yeah.
Yeah.
So they were really, glad that they participated because it was quite an exercise to try to figure out how to take a limited amount of dollars and spread it out. I said, welcome to the club now. So.
The Harbor Walk US 41 northbound bridge underpass, the committee recommended funding at $50,000. That's a project that could potentially have other sources of funding as well. The Henry Street Campus project, so that combines two projects. There was one submitted from the outside for this, and staff had submitted one project for this. It comes in as one project now, that with a total cost of $3 million. And for your next meeting, I will have all of the CIP sheets on these for you. And I have a CIP sheet that combines both of the projects, and it looks like it's about $300,000 in engineering, $200,000 in land, site, and construction services, and $2 million worth of improvements. And you'll see the committee recommended almost $2 million in Tier 1 and an additional $1 million in Tier 2. This was a project that the committee was really excited about.
So would any of the park impact fees qualify for this? Kristen?
Yes, the answer is yes,
Answer is
because
yes,
we're
okay.
adding pathways and parking.
Okay.
Just one caveat, yes, although some impact fees will be there, there's gonna be some competing projects for your park impact fees. Okay, so I
Just
just.
to understand, just trying to
Yes.
understand, okay.
Yep.
Boca Grande Drainage Area, this project the council is very familiar with. The committee recommended almost $1 million in Tier 1 and another 1.469 in Tier 2. A safety project. And septic to sewer, the committee recommended $997 in Tier 1 and $1.469 in Tier 2. And Mr. Kunick, would you mind giving us an update on where we are with septic to sewer?
Well, we have negotiating with a financial firm to do a rate study. And once that contract has been negotiated, it'll be on council agenda for approval. We will do the rate study, which shouldn't take, it'll take a few months to do. And then we will then be bringing to you the impact of the rate study, and then coming back and starting selection for a design firm. All of this will be on our dime to start with. We could use, if you want to keep a project such as this in the sales tax program, we could use the money for design. And then the county is already on record as stating that they will establish an assessment area when we get there. We're pretty far from that point right now. We need to get the rate study completed, get our rate structure in place, perform a design, which will include phasing of the project, and then we can go to the county to establish an assessment area.
And I would like to say that on this one, I would say they were unanimous in the fact that it needed to be done, and they were almost as unanimous that it should not be sales tax money because this would not be sellable to the people who will be voting for the sales tax.
Agreed.
They're extremely worried that the perception is that we're using our city sales tax money for a county project. Even though it was explained over and over again, and very well, that I'm just telling you that that was a big concern.
Right.
John, I think you had your hand
Well,
up,
it gets
too.
into more detail, and I don't know if I want to do that. Now, the money that was requested, the 3.2 million, was to do what? To do the rate study and then?
No, it's had nothing to do with the rate study.
What did it have to do with?
This is the actual construction costs of a Charlotte Harbor pre-design construction estimate from the consultants who did the study, the master plan, to do Charlotte Harbor.
Okay, so
Charlotte Park, excuse me.
if we were to not fund this at all, then as we move forward with that project, we'd have to use or wrap all the costs of whatever we do into the final charges to the residents. Is that correct?
It would be a combination of our current and future utility rate customers would be charged a portion of this, which they're going to be anyways, and assessments, some combination thereof. And the rate study will bring out what those possible impacts will be.
I think one point I guess we can't forget with this is that though this is in the county, because they're going to become our customers, ultimately it is our project because they're going to be paying, they're going to be connecting to our utility system. So it's more a perception thing. We probably have to do some degree of sharing that with the public so it doesn't look like what it looks like.
I don't know, some of these folks sitting at the table were pretty smart. I'm not sure that,
Because this is our project, ultimately. I mean, it's for us.
Yeah.
We're going to benefit from it
Well, it is-
materially and
But
environmentally.
we do have a way to pay for it eventually if it goes forward.
Yeah. Lynn?
Further to what Debbie just said, I can tell you, after sitting on the county's committee for the last 6 months, this list and this priority is not going to pass. There has to be some serious discussion on our part before we submit this for approval for the voters to look at it. Because if you submitted this list as it stands today, it will never pass with the voters. You talk about public safety issues, you talk about fire and police and sidewalks and things that are of public safety concerns, people will pass it. You talk about planting bushes in a park, if you talk about septic to sewer, they're not gonna pass it. It's not gonna pass. That's just the way it is. And we sat for over 3 hours at our meeting a couple weeks ago, and we hashed through every single project and how much was gonna be allocated to every single project on the list. And I can tell you that this just needs a lot of work. That's all I can say.
The whole list or just this item?
The whole list.
Okay, well, you're being very quiet as we're going through
Yeah,
this. So if you have items that you want to discuss, then you should discuss them as we are going through this.
So like what, you don't think the hounds on the.
If you didn't like Hounds on Henry or whatever it is, you need to bring.
I do like that, but there's also a concern about you spending that kind of money for a park.
Do we need to back up?
No, I don't think we need to back up, because I have some other comments I wanted to wait till the end for, because there's projects that are not on this list, so. There's things that have been mentioned to me. And if you want to hear about it, I'll tell you right now. I can tell you that sidewalks on Henry Street is a major thing that I've heard
Right,
time
that's the
and
list,
time.
that's on the unfunded list, so
Right.
let's continue
That's
on
what-
then. If you are okay with what we have discussed so far up to this point, but.
I think that City Hall improvement needs to be right at the top of the list. I think that's critical.
When you say City Hall, this building,
This building.
the historic building?
Yes,
Mhm.
absolutely. That needs to
Absolutely.
be at the top of the list. The public safety building, people want to know what exactly are we going to do in the public safety building that's going to cost $5 million? What are we getting for $5 million?
Well, they presented it to the committee.
That's fine.
And
but
I'm sure it'll be presented to you.
all we're getting is a list. So I'm basing it on what I know about some of these projects. I can tell you that the Bayfront Center is of critical importance. That building is crumbling down. That's got to be fixed. And things of that type are really, really important to the
Okay,
people.
well, the reason why we're going over all this is for us to discuss this so that then we can massage this list because we're going to have to ultimately bless something, approve a list to submit to the county.
I understand that.
So
but I was
we
gonna
wanna
wait till
hear
the end
everything you
because
have.
I've got a lot of things that have been brought to my attention.
Okay, but are there things that you wish to have discussed on some of these other items that you did not mention? Because we
Not
should.
yet. I was going to wait till the end.
I'm thinking we should discuss, if it's on a particular item, we should discuss it while we're there. No?
I mean, the things that I would like to see on the list are not on the list, so.
Okay, so my question was, is there anything that we have discussed so far that you wish to have brought out that you didn't? Like you just mentioned the public safety building expansion. It's really wanting to know more what about that. It's a lot of money and a big chunk of change, not that we are not all for public safety whatsoever.
Yeah, exactly, but
But
again,
it's-
but what are we getting for that $5 million? That was
Right.
a couple of people have asked me that,
Mhm.
and I agree. I mean, we're not
Question?
getting the detail on this, we're just getting a list, and that doesn't help me at all.
Yeah, I know that Debbie, that Chief Briggs and Chief Davis both presented and gave a lot of detail to the committee, so it's,
They
I don't
did.
know what that was, but.
And just based on the slide, it's the expansion and renovation of existing facilities, adding new space, a new emergency management command center, and some room for growth.
I mean, they're here now if you want them to present more information to you.
That's a very big,
We certainly need it at some point.
yeah.
Yeah, I think it would be great if they could come in and just at least give us a
Okay.
little bit of a feeling for.
They're here.
I'm all about public safety. I think that's
No,
been my mantra
I'm
from
not-
the very
I
beginning.
hear you loud and clear, Lynn. I just want to make sure that we can discuss these items as we go through, so we don't have to,
They're here.
Okay,
They are.
guys.
All right, tag team.
Wow us with your
You
plan.
got 3 minutes each.
Chief Pam Davis, Punta Gorda Police Department.
Chief Ray Briggs, Punta Gorda Fire.
So, yeah, we are busting at the seams. A lot of our, for instance, we just recently added the community engagement unit. There is nowhere for them to work at all when they're having to write reports. So they'll come in and they'll use like one of the write-up computers or something like that, but there's no more space for them. Storage of equipment, our evidence unit, we have 10,000 pieces of evidence that, and you have to maintain that for a certain amount of time because of the evidence rules and procedures. So it's busting at the seams. We're even using the garage that was supposed to be for processing cars and things as extra evidence storage. So, I'll
So
let the fire
likewise,
department-
on the similar note, when we went into the agreement, when we brought Charlotte County Rescue to run a rescue out of our house, which has been a great move, and it's a great service that we provide, we are completely out of room. In fact, we renovated a closet which housed our cleaning supplies, and there's at times six people that work out of that closet. If you've ever been, that's our report room. They're in there the majority of the time. So the project, and I think Melissa said it, is that it's expansion for office space. I have our position, our training chief who we brought in this year, and he's in a workspace that really wasn't designed. We're looking where we can renovate a copy room for additional workspace as well. So to say we're busting at the seams is
So
kind of an
where
understatement.
will we be expanding the building out? And-
Okay, great
And how
question.
much square footage are we talking?
So I don't have it all in front of me.
Square
We
footage,
put together.
square footage I have, that's 13,855 square feet
That's new?
Additional.
additional.
So if you look at the building, we're all familiar with it. So our piece would be that we are going to expand into the current training room. That would give us the additional bunk space, and that would be, we're gonna expand in there and then out the back of the building. So
You have
kind of where
some-
the building kind of makes that loop, we would expand out to there, and then I
We can
think
move the training into the back and we would expand out the
where
back
the
as well.
community garden, I think
Yeah.
your plan
Yeah.
was to expand into that community garden area. So 2 expansions going out the back.
So you
Back
have
and you-
diagrams?
We don't have any of the,
We based our information, in fact, I think we got some of our numbers initially for
from
the,
Public Works.
yeah, I think Mark Garion helped us with construction costs. Honestly, so there hasn't been we haven't had somebody come in, and we don't build buildings, so we would have to have somebody come in and help with that. But Mark Garion was willing to help us with some numbers for construction costs, and that's where.
And you'll find, if you look at the projects for public safety in Charlotte County, building new fire stations and facilities, they are right at this same budget mark, right around $5.5 million. So,
And I know that the committee, they had a lot of ideas. There was a lot of question and answers, about, building a different building, moving. The old library site was a consideration. Is there, separating out. I think I speak for Pam in that we're willing to do whatever as long as it increases some space. We've got projects that we would consider in the future with quick response vehicles and things like that. But I can't even approach that. There's nowhere to put them. We're locked where we are until we have some space.
I know that the public records area is kind of, you're not using paper files anymore, so there is a little bit of space there, but that's just a touch. I mean, that's
Right, and
not the
we have
long-term
about 80
solution.
volunteers. We've got our coordinators all crammed in that little office that our accreditation manager used to use, and we'd love to be able to move them out and put them into the public records, or the records area, but that still doesn't.
Would this also then bump out to the north as well?
Yeah.
No.
Just so
we don't think, 'cause
The
that would
site
go in
won't
the-
allow it. The site, in fact, in the original, and I guess I'm the
Yeah,
old
you're
guy in
gonna
the
have to
room
speak.
because I was there when we built the building, but future expansion was designed exactly what we're doing. That, if I recall, and particularly on your side, there's her side and my side of the building, but, so on her side, the intended growth was to go where the garden is
Okay.
right now, and then for us to expand out, just exactly what we're talking about. So that was always the plan
Is there
for future.
expansion to the south then, is on the other side of the?
We would have loved that. That
Could've got that
property
property.
is, I think that ship has sailed.
Okay.
So that property was something we talked about years ago,
Hmm.
and I don't know where it is, but I know it has sold, and I don't know that it's available. That was a consideration. Then we would just build on the other side of our bay and forfeit, the rest of the property to PD. So that was, we've looked at a lot of options.
Okay.
So there is space on that footprint
sir.
now to do it.
Yes, sir.
Which is why the committee, I think, was so in favor of it, because it did not require buying land. All of the dollars go towards the actual
correct.
building.
It sounds
That's a
like
good
you
point.
keep the front facade pretty
Yes,
much as
it'll
it
look
is.
the
Exactly
same,
right.
yes.
You're exactly right.
And we don't destroy the murals.
Yeah,
Nope.
right. No mirrors.
Okay. Other questions?
That helps.
I think it helps, but it certainly, the more we have written down in detail about, well, we're going to move this room to here and sort of thing, would be useful as we try to convince
Yeah.
constituents.
I don't think we can make a decision without having a little bit of information on each of these projects, and what does it mean?
This one
and
is the
what-
biggest one
what are we
and the
getting?
most
Right.
important one, so
We can certainly
take it
sit down.
down the
I
road a
think
bit in terms of.
something that would help, because constituents, I agree, are going to want, that I've received questions. What is it? And I don't have any answers, so, not that people are against it, it's just
Yeah.
we have to sell it, and people
gonna
want a
happen?
safe community, and,
I got a lot of emails, so.
Jaha?
And to Lynn's point about the county side, I was at the strategic planning meetings, and they were just making a point that infrastructure is what they're going to want to support rather than quality of life. So that's why, at the end of the day, what we put forward is going to need to be in that box.
Yeah.
That's,
Thank you. That helps a lot.
Thank you so much.
All of the presentations and the CIP sheets that the committee has already received, if you just go to the search box on our website and put in sales tax or 1% sales tax, you'll get to that page and scroll down to the bottom, and everything is there as it was presented to the committee, so you can take a look at that. But I will put it together in your next agenda packet as well. But in the meantime, feel free to take a look at that on the website.
But this information about the police station, fire station, was not in that kind of detail.
It's the most detail that we have is on the CIP sheet.
Yes, I know. But it
And
doesn't
it-
say, we need a room to do this and a room to do that.
It does to some degree.
Does
I
it? Okay.
can understand as we go out to market this to the community, we're gonna need more information, but this does have a snapshot of what they're asking for. It talks about the anticipated growth with needing a new training room, talking about reconfiguring the office space. It's all in the description on the CIP sheet. Pretty pictures, of course, would be nice, but we're not even at that point where somebody's put design work into it. If there are any other ones as I go through here that anyone wants to have more detail to right now, we
Were
can
there
certainly
any
stop.
other ones that,
Well, I got a lot of criticism about the capital project management.
I got questions about that as well, but that's one I think.
Well, that pays for one staff person. And that staff person oversees a
It's
lot
co-
of the sales tax
It's
projects.
kind of like the Travis Mortimer of,
Yeah. So if you don't want to fund it, then it comes out of the general fund.
Yes. So,
Somebody's got to manage the projects.
I understand that some of that management will be outside too. It doesn't have to be a person that we have on staff. Is that true?
Sometimes, when it comes to like LAP funding, the federal, through the MPO, on some of those projects, we are required to get an inspection firm, but we still have a project manager that works with that inspection firm. A lot of these projects, take the Veterans Park Phase 2. We had a project manager on that. Even Alligator Creek, the bridge, we had a project manager helping out on that. A lot of the park projects, the Harbor Walk, we're going to have a project manager working on that. It funds a staff person a year.
there was a project management component in the 2014.
Oh, yes, we've had it for a long time.
That's why this was accepted. It was just,
Yeah.
it automatically got on the list.
And again, I think that if it was spelled out a little bit more in detail of exactly what we're talking about, I mean, I understand it says to oversee the various construction of projects, but people don't understand that when they read that. They don't get what that really means. And I'm just trying to tell you the comments that I have received, and I got a lot of them. But people want to see the money in this particular program used for things that are critical to the city's future and making sure that public safety and, as Jaha mentioned, we want to make sure that things are tangible, I guess is probably the way to put it.
Then what I would say is if we choose not to put this in as a separate component, then we need to incorporate it into each of the prices of the project.
Because you need this
Because we're gonna
function.
need it
Yeah, I understand.
one way or the other.
I understand that too.
But it's been in the sales tax as a separate line item.
And that's fine, as long as we explain it and what it really means and why we have to have it. I mean, and maybe that doesn't get at the top of the list so that it doesn't call, you know what I'm saying? It doesn't call attention to that, because when people look at the list, they're gonna look at what's tangible and what does this mean to me if I say yes.
What happened, I think, the county did a really good job of this in the last time, was explaining Travis Mortimer's position and why they brought him on board, and to ensure that the projects all got done in a timely manner, and et cetera, and he went around them making presentations, et cetera, so that was.
Yeah, this doesn't pay for a Travis Mortimer.
No, I understand, but it's our version.
It's
Kinda.
kind of. We can certainly.
Of these projects.
We can certainly take these costs, 540,000 over 6 years, and divvy them up among various projects, and you won't see this.
You could do that. The committee, though, this is one that they were willing to pull out, and they wanted to pull out right away as the top item that needed to be funded. On the CIP sheet, it spells it out fairly clearly why we need someone like this. It spells out that it's an engineering division of public works position. It also explains that how it's funded, that it transfers, the funds go to the general fund. So the I think we have solid information, and it's just a matter of what audience we're speaking to, because the PowerPoint does speak to some people, and I understand that other people need more detail, and that's why we've got 2 versions of it.
You want it left separate? Or do you want it?
I don't, the committee was, I mean, they pulled, out of the entire list, they pulled the police, they pulled this, and they pulled the city hall. Those were the things that they were just adamant, because they knew we had to have this.
So we just have to do a better job of selling this particular one if we want to
think
keep
so.
it.
Okay,
Maybe it doesn't have to be the second thing on the list.
okay.
Right, and
Are
this.
we going to reprioritize this whole list?
Absolutely,
Yes.
yes, and
That's
then
why we're doing
it also has to do with phasing to, the money's only gonna come in at $2.45 million projected per year, and what year are these projects gonna get done, and those type of decisions have to get made ultimately too.
Were there other comments that you wanted to make on any of these other projects leading up to this point, Lynn?
Again, septic to sewer, that was at the bottom of everybody's list. I understand that it has to be done, but we have to find other ways to find money to make it happen.
And just remember to, in framing and talking about that project outside to people, it is a water quality project, so we do need to make sure that we're using that kind of language, and it does definitely impact our harbor. Additionally, I had met with urban design staff, and they had some projects that were not funded that they thought needed some additional consideration by council. Complete Streets Airport and Cooper, that has already been designed.
It's under design.
It's under design right now. And the same with Complete Streets Shreve. Harbor Walk East Phase 2 is another one they thought was important.
I had a comment about that someone asked why we don't have pickleball courts on that inclusion. And they would like to see that be folded into that project if it gets approved.
Okay. We do have it as a part of another project. It was a standalone project with, we could have either done Trebu Park or Trebu Park and pickleball, and neither one of those received funding or a lot of favorable discussion from the committee.
Gonna be residential building there. That's really bad.
It's very low.
Well, part of the reason that it sort of got dropped too was that we negotiated the 8 courts at Pickleplex. And so I will tell you this, the vote on the pickleball was unanimously no, wasn't it?
It
They wouldn't
really
even
was.
consider it. We had speakers come in from the pickleball community 3 times, and pickleball was an absolute no.
I think part of it is getting people to vote for the project.
Right.
Yeah, because the county is gonna look to possibly put more money into Pickleplex, and so, we have to think about.
Have we heard anything yet on the tourism?
We recommend, didn't we recommend?
We voted to recommend
Did vote?
that,
Yes.
yes, we voted to recommend that the tourism board voted that the commissioners should provide support to the Pickleplex.
Okay.
Commissioner Truex did not want us to specify how much, because the Pickleplex was asking for over $900,000. And he was very adamant that, well, they're not going to get $900,000. And we said, we just want to say, we feel you should give them support.
Yes.
That was what you all did before I was on the TDC.
Right.
The TDC voted the same way.
Yes.
So, and the motion passed. I made the motion, Jaha seconded it, and the motion passed unanimously. So Commissioner Truex was a part of that. So I know the Pickleplex has been meeting with each of the commissioners, and some commissioners the opinions vary.
Okay.
So we have, there's work to be done, but it's work in process.
But tourism is very supportive, and especially the person dealing with sports really sees the value for a community long-term, very much.
But our committee did not.
Alligator Creek, US 41 pedestrian bridge 2.
Absolutely not.
Next.
And sidewalk improvements on Baynard and Vasco.
Is it needed? I want to go back up to the Alligator Creek. Is it needed? Yes. Will people vote against it? Yes.
Yes.
So I think we should.
Especially after they've seen the one that's already done.
And the Taj Mahal is beautiful.
Yes, it is. Bring your army tank.
Now, this was a project that was already funded years ago. This was funded years ago, and then we moved the funding to put it on 41, and it's like, well, what happened to the funding?
Kristen Simeone, Finance Director. So it was funded at a $200,000 level, so we're just asking for additional $200,000. So even though it got moved off, it did get moved back to this project, but at the same dollar level
So we still have that $200,000 sitting there?
in this project.
Okay, so then instead of 400, you only need
200.
200.
Only 200 is still needed. So it was one of the ones that was an existing project that still needed additional funding.
Now, isn't this true of other projects that we have on this list too? There is money left over, and it's not clear to us right now, or not clear to me,
So
how much that is and how it would change the numbers that we're seeing
Right.
here.
So there were several projects that were requesting additional funding because, of course, it's many years ago where some of these numbers were developed and the project costs are coming in or again, are still just projected because they're not fully designed yet. So one of them was like the airport and Cooper Streets. Those were both current year fundings that had a certain level of funding, but now the costs are a lot more, and I think especially with the Cooper one is related to the railroad and stuff like that. So they were requesting additional funding. It exceeds what we project through the end of this particular cycle of 1% sales tax. We currently projected $1 million at the end of having remaining that's not in a project already, that might be able to be used for some of these projects. So that's why they were asking for additional funding. We don't know which projects are gonna need it and at what point in time yet, so.
See, the airport in Cooper, this Baynard Fasco, the committee did not place any additional funding for these projects, even though there are some dollars left within this current program.
So these
That
slides
is why
don't-
they're on the list.
These slides don't mention how much funding.
Yeah.
They do
is
not. They just have the
available.
total project budget, and then to the slides that were funded by the committee, I added what their recommendations
And
were.
this other summary we have doesn't really identify funds either that exist.
It would be helpful if we had the, on here somewhere.
Yes.
What the other sources
Yes.
of funding could be.
Yeah, what
Yes.
funding is really available. I mean,
brought
like,
that up, yeah, okay.
already set aside for it.
So on this one, this particular one where they have the total project cost, you do see the total project cost and it says what's still left. So I mean, again, we didn't come out and say, okay, this was what was funded, but what wasn't funded was included.
Okay, I guess I
So-
need more instruction on this, because to me,
Yeah.
some of this does not have,
Yep.
does not say that.
I understand.
In some cases it does, but in other cases it doesn't.
So that funds still needed column was specifically only on projects that have already been started with current sales tax
Can
money.
you use lighter
Yeah.
or ink? Because
No,
when we
no-
print this
no
out
colors
in
would be
color,
good.
it really is dark.
We don't need color.
No.
No, that's fine.
The color.
Just make it different.
I just printed mine black and white and it works better.
Okay, so what we'll do is, we will show you exactly what is included in the current sales tax program for these projects and the additional amount needed. The committee, again, did not allocate any additional dollars towards these projects.
Okay.
They felt like it was, the comments that they said to me was they thought we were starting to go really too far towards bicycles. That, everything was looking at bicycles and not enough. We still have places that are desperately in need of crosswalks. We still have places desperately in need of sidewalks. And instead, we're putting in bicycle paths. And that was a real issue that I heard.
I've heard that from a number of citizens, and sidewalks on
Henry.
Henry Street, I'm sorry. Henry Street from 41 down
Right.
to where.
We've received emails on that one for a
Hundreds
long
of them,
time.
Hundreds of them. And sidewalks on the south side of Marion, from the Visual Arts Center to Bell Harbor Boulevard. There are segments that are there, and then there's vast areas that are not. And it's very unsafe for people, because they have to literally go out into the road to continue walking, and it's just not safe. And a crosswalk somewhere in that vicinity, so people can cross from one side of Marion to the other. Those are three things that were adamantly, really, really, really highly requested by people that I've talked to.
I wish they would have brought it to the committee. I mean, we did get sidewalk, or the crosswalks, but the cost on that was just
Well,
staggering.
these are all in the not funded,
Not
so let's
funded.
get into that list.
Sure,
then.
the first project, drainage improvements, the stormwater, the committee did not feel at this point in time that this was a priority. Bicycle capital improvement program, Councilmember Carey just explained really what the sentiment of the group was there. The Visual Arts Center project was very, very much supported by the committee. They wanted to see this happen. This would only happen if we had an economic development set aside. In researching, we couldn't find any other municipality that had already gone ahead with that economic development set aside. There is a potential that if this council wanted us to still go down that road, we can still explore it. But then again, the county is not doing an economic development set aside either.
Plus, the committee did not feel that, even though this was a wonderful project, it doesn't really meet economic development. It's not going to provide jobs. It's not going to, provide. It's just a nice thing to do for the Visual Arts Center.
Historic district interpretation markers in the historic district really didn't get any consideration. Shreve Street Trailhead, that really kind of becomes a moot point if there's that investment in that West Henry campus. Complete Streets Virginia, no consideration. Maud Street angle parking, really no groundswell of support for that either. Complete Street Royal Ponciana, nothing on that. Sidewalk enhancements, Tropicana and Marion.
This is what you're talking about?
No,
Sidewalk enhancements, truck,
not
Buchanan,
on this
Marion?
particular one, no.
Okay.
Historic District streetlights, again, not really any support for that. Henry Street crosswalks, this was a citizen-submitted project that did get a lot of support from outside organizations. We did hear that this was endorsed by the PGICA. I believe also Team Punta Gorda endorsed this, and the committee didn't fund it, but there were outside interests in the community that are also very interested in seeing this move forward. And if it doesn't move forward in sales tax, I think you're gonna probably hear from the community or some community members that want you to consider it in some other form of funding for this.
Where is this supposed to be, please? Because I can't read it on the map.
It is, let's see.
It's where the white line
That
is.
mod?
It says unsignalized crosswalk. There's like a white bar there.
But what streets are we talking about?
That looks like Maud. It's at Maud and Henry. Crosswalk at Maud and Henry.
The
I
one
know
going
that
this
people
way
would-
is Henry.
You get
So
lots.
for orientation on the map, Mitchell Austin Urban Design, this is the Bass Inlet Bridge where the pointer is right now, and moving west on Henry Street into somewhere in the area of Maud Street. Other considerations were crosswalks at some of these side streets. The citizen-submitted project also spoke of potentially connecting additional streets further down. When we looked at it, the area of critical concern seemed to be this being able to get across at or around near the vicinity of the Bass Inlet Bridge, where we have existing sidewalk infrastructure on the north side of the right-of-way.
Right. They would like to have it there, but all that traffic comes over the Bass Inlet Bridge and then is turning left on Olympia. So it's probably better to have it kind of where it's been positioned so that the pedestrians are avoiding that traffic. But I've heard a number of residents that live in this area, we'd like to be able to cross over and safely get to like PGI and,
Yeah.
And
not PGI, but Fisherman's Village and.
Some of the people on the committee also felt that this was almost too trivial to put on the sales tax, that the city ought to be able to come up with this money. That was said numerous times. That's,
This was also a much simpler request originally. It just really wanted to put a walk across as you got across the Bay
Yeah.
Bridge there,
Well, I
Bass
think-
Bridge. And now we've added
Didn't we have-
sidewalks and other,
we had to add the cross, wasn't there a reason we had to put in the Hawk signalized crosswalk?
So when the citizens submitted this project originally, their request was fairly simple for additional sidewalks on the southern side of the right-of-way there at Henry Street, and also for crosswalks to get across. In looking at it from an urban design and public works engineering perspective, there's some significant challenges to making sure that those crosswalks are safe. So that's why the project sort of grew exponentially from what the initial request was. Because we want to make sure that whatever infrastructure we install, that we're doing something that is going to be safe for the users.
And again, a public safety thing.
Right.
This would be approved
Public
by
safety.
voters, where some of this other stuff won't be.
It's public safety,
Yeah, it really is.
yeah.
Harbor Walk US 41 approach lighting, bridge approach lighting, another one that was not funded. Henry Street
That one,
sidewalk.
I'd like to comment on.
Sure.
That was a project that was included in the 2014 sales tax. I remember it being as an approved project, and then it kind of got moved and said, well, we can probably find grant funding for it. So it got moved off of the approved project and into grant funding, and then we never found grant funding. And it's like, this project needs to be done. It's like, there are decorative lights on our downtown, and then all of a sudden there are 4 highway lights and then decorative lights across the bridge. And the owner of the 4 Points by Sheraton has asked for this. When are you gonna get rid of those highway lights and put decorative lights? And it's both on the northbound and the southbound. And here I see it, and now the community's not even funding it, and it was funded in 2014. So, and then because staff thought it was gonna get grant funding, we took it off, and it's now nowhere. So I'm really kind of concerned about how this project never got done.
Can we find out if grant funding is available at this point? Or
Is it
if
in the
it's-
budget?
I don't know. I just have a big question about this project.
I don't remember this coming before the.
Well, it didn't come before you guys. It was before, this was in the local option sales tax.
Well, we must have, because we ranked at 23.
But I mean, it came before this, but I'm saying, it's never come before council, I don't think, but it was part of the 2014 sales tax
Okay.
that got approved.
But you didn't have much discussion at your committee.
I don't know what happened. I think we ended up using the money on something else because we thought, well, it can get grant funding, and it's like, I'm not sure what grant funding. And so we probably used the sales tax dollars for something else, and now it didn't get done.
Well, further to your point, the owner of 4 Points by Sheraton would like to see us do a whole decorative lighting project on the waterfront. So that, that is something we should think about finding money for, if there's grant funding or otherwise. And if it isn't grant funding, then maybe we need to take a look at this being on our list.
Kristen Simeon, Finance Director. We do currently have $120,000 in this project. I'm not sure why it says projected budget $300,000. However, our sheet currently has it at $670,000 with $550,000 unfunded.
670?
Is that this one right here?
That much to replace those lights?
Currently, it is unfunded on the priority list for the FDOT project, Joan LeBeau, Urban Design Manager, and we have been trying to work with them to get it moved up on the priority list with FDOT.
Oh, okay.
Okay, so we do have 120.
So we've got 120, okay. So I'm not losing my mind, okay, good.
I'll find the dollar.
Thank you.
Again, this should be identified on our reports that we're looking at.
Okay.
It says here, right here, 120, sales tax funding, total project cost 670.
Not what was on our attachment, I don't think.
So anyways,
Okay,
120, I don't know how much it's going to get you, but
yeah. So then, that brings us to the Henry Street sidewalk limb, which you were speaking of, and I know that we have had numerous questions about this.
And that road is
In
very
emails.
dangerous.
Mhm.
It's very dangerous for people who are trying to bike or walk.
I agree. That one needs to get on the list.
It definitely needs to be on the list, however we make it happen.
Sidewalk connections, West Marion, Bell Harbor to Shreve.
This is the other one.
Gilchrist Park Harbor Walk improvements. These were things like the seating wall, benches, shade.
pergolas,
Pergolas.
that didn't make the list.
Park and facility signs. Committee thought that this was definitely too small of a project for them to consider for sales tax.
Too small.
Harbor Walk, Lashley, Marriage Point. That one is
Oh, that divorce point. We keep
Divorce
divorcing it.
Point. Well, we still had it on here,
One that we
and
took all the funding from so we could do veterans.
Because it was Lashley Park.
Keep divorcing
Yeah.
it.
yeah, and it
Yeah.
did not get very high priority, but I do know that we have had resident interest in this area and wondering why it doesn't look like the rest of
Yeah.
it.
Again, it's not a need to have, it's a
Yeah.
want to have.
If there's any
It's a
way to
nice to
spruce
have.
it up, but
History Park maintenance, this was a citizen-submitted project that was trying to go under the umbrella of economic development. Veteran,
I just would like to say that when they presented this to us, they had absolutely no budget. They had no guidelines on how they were going to spend the money. They just thought it would be nice if we could give them the money and they could use it to fix up the park. So it got dismissed out of hand.
and it had been explained to them that the only way that we could invest in property is if it were energy efficiency improvements, and none of what they talked through had anything to do with that. So that one did not work for this committee. That was still part of that. Veterans Park shade structures, that was one that council had asked staff to get onto the list, and that didn't rank very highly, and it really didn't have any positive discussion at the meeting either.
And I personally think, since we've just spent $450,000 on that park, this would be hard pressed to be passed.
It would be hard pressed, yeah. I've had conversation with Charlotte Miller from FPL, and they have not released the Solar One budget, but she said she thought that it might be a project that they, Solar One, when they do, might be interested in.
That would be awesome.
That would be good.
So we just need to get with Charlotte Miller.
Chiboo Park improvements, this was the project that didn't have pickleball in it. It ranked 36 and it didn't have anyone really excited about it or speaking on behalf of it that was on the committee. Chiboo Park pickleball, we've discussed this. We heard from some residents that were in support of it. We did not hear from the committee any support for the project. South Punta Gorda Fire Station 2 park improvement. It's safe to say we heard more against this than we did for it. Harbor Walk West Area 3, another one that just really didn't receive a lot of attention. The park kayak ramp, it was a citizen submitted project. Again, it really didn't generate any positive
I would like to comment on it.
Sure.
So this was actually a Burnt Store Isles Association want, and the lady who was supposed to present it to the council, her husband was very ill, subsequently passed away, and she was not able to be there that day to present it.
That's true.
And it's, there are no projects, well, I should say there are none. There was the one, the Royal Poinciana, but they're very little in the South Punta Gorda. This is property the city already owns. It's where the old fire station number 2 is, right along Alligator Creek, and it would be a really nice area for a kayak launch. So it's a minimal investment to add something. Now, whether there's enough space to put in an ADA accessible one or not, I don't know.
And I think there's some question as to whether $20,000 would even,
Yeah,
it's
I don't
probably
even know.
not,
This number's
not
on there.
enough.
It was just that we thought it was really, it was discussed at the Burnt Store Isles Association, and people really thought it was an interesting concept, and
$20,000, make it ADA accessible, there's a
No,
deep
no.
slope there.
No, I said, I don't think this was enough money to make it
Right.
ADA accessible.
What are we doing about the kayak launch that was proposed out by Ponce Park? Are we doing anything with that?
Not presently, because we put that project on hold until we finish the boardwalk pier.
So
And
it would be part of
see,
the Ponce renovations if we ever.
when we bring that back to you, you can decide what you may want to do.
The reason why I thought this one was a nice area for a kayak launch is because kayaks going back up Alligator Creek, it's protected, it's, that kind of a thing. So I got a lot of feedback on this one.
Well, we actually didn't, we not only didn't have a presentation, presenter, there was no presentation. It was just kind of like, they'd like to do this. And I think a lot of the feedback was that, if BSI wants it and it's only $20,000, they probably could raise that money. But I think it was probably lack of presentation. And we just didn't know what they
Well,
wanted.
it's, offering, if you want something from the south, feedback from the people in the south end of town, then this is what they were saying.
We don't get many requests from Burnt Store Meadows, Seminole Lakes, and Burnt Store Isles, or for PGI for that matter, but especially the south end. We don't get many requests. We did have the Royal Ponciana on the list, but it didn't make it.
Right.
I
And
don't-
they didn't want it either.
So again, we'd love to do projects in the south end of the city, but when the community or the communities there are reluctant, it's kind of tough to do that.
Yeah, we tried to do a park down there, and they didn't want a
Oh,
park.
my God.
And the
Oh.
park that is on the list where the residents in Seminole Lakes don't want to see a park there because it will get rid of all the vegetation that's across the water. And then they'll see Eckline Road, and they don't want to, because I
So-
remember when we took the invasive species out of there, and all of a sudden, now we had a whole lot of vegetation that was missing, and their comment was, uh-oh, we can see the road, and we don't want to see that, so.
Do you want this on? Do you want to, I
I
think
would-
if we put it on, we need to change the budget. That doesn't look.
I'd like for us to consider it, it's.
And then could somebody from BSI put together a budget, a better budget?
Well, I wouldn't put it on them. We would have to come up with a better estimate. You can't put it on the residents.
Well, everybody else that made a proposal had to.
But if you feel its project is worthy enough, I think as a staff, we could probably come up with a little better.
Yes, and we did help with.
Oh, did you, with the 20?
With the crosswalk project
We
and
would
things, so.
If you can, I don't know that, if we were to put one in, if we would be required to make it handicap accessible. And I've seen
Yes, we are.
Julie shake her head.
Yeah.
And the video that we saw of the handicap accessible one really is slick.
And the association does stand behind this project?
I don't know. They didn't never.
Okay.
Yeah, it was discussed at their I don't know if they actually took a total vote.
Okay.
Where would it go?
Is there a
Because
site
there was-
that they would put it? I don't see where it'd go.
Fire Station 2.
No, but we mean on here, like there's this waterway. Where would the?
Oh.
where
Oh,
would
it's
the-
right along,
On the
it's.
Home Depot
right-
side of that? Or not on?
That's, that building you see where there's, that Mitchell's circling,
Yeah.
that is the old fire station number 2.
Okay.
So right there.
And so if you were to go over to Home Depot, pull
Yeah.
into their parking lot and go over to the right and
Done it
continue
many
back here,
times, yes.
you'll go back there. And that whole area is actually owned by the city,
But I'm asking, where do you want to put the ramp?
It'd be-
Just right
wherever
there?
it's the best spot. Wherever the best spot is. I don't know where the best spot is.
It's tough. There's a slope there. We would have to scope it out.
There'd also have to be parking.
Well, there is quite a bit of space there.
Yeah,
There's quite a bit of space there where the fire station was.
Yeah.
The only problem is if Ray's burning
Yeah, but they use it to
burning up
burn
a car, chopping
burn
a car
something.
there, but,
This is also the south exit lane out of Home Depot.
No.
To the
No.
left, to where,
No,
to the
there's
left of
another-
where the trees are.
well, that does go out.
Is that one of the Home Depot's driveways?
It's not
That
the-
takes out to Burnt Store Road?
It is, but the main one is the next one, north of that.
I know that,
yeah.
but I'm asking that for a very specific reason.
What's your reason?
Trucks.
Well, I did my road tour with the FDOT last week, and I asked if they would consider help working with us to put a traffic light there, so that all truck traffic could be routed out that exit. Because they can't do it where the tower sign is, because it's too close to 41 and Burnt Store Road. So he said if it was that much further down Burnt Store Road, it could qualify for a possible location for a traffic light.
It's right at the bridge.
Yeah.
That's kind of weird.
Well,
We just had a little staff sidebar on this, and this project is probably actually about a $500,000 project, just,
that changes things.
right, just, because you realize you'd have to have accessible parking there,
Okay.
all the requirements that would go into it. We can certainly put together a CIP sheet, but just so you know, this would come back to you more as a $500,000 project than a
Gotcha.
$20,000 project.
Just like that.
Okay.
Yeah, right.
Well, they get
No,
that.
you see it? No, you don't.
And sometimes you can't expect some of the folks from various neighborhoods to know about all of the ADA requirements.
don't.
You don't, I mean,
I mean, it's kind of like we thought we would investigate, kind of like cohabitating Burnt Star Isles Association, you know, moving into the old fire station and kind of sharing that space with the fire department. That building's in pretty rough shape.
yes,
so.
it is. So, you know, you have to, with all respect, I mean, they can't know all of those.
No.
They really can't.
It seems like a really reasonable suggestion, but when you start looking at the dollars.
Right.
Okay.
So what's our next step? Then we all go
Well-
home and put these in order for us, or what?
Well,
Yes.
I'm glad we had this preliminary discussion.
Right.
So, timing-wise,
It would be my intent that we would have this then on the April 1st council meeting agenda.
this would be the only, hopefully, one of the only topics on
Only
that
major-
agenda.
Major item. I will have Kristen get this in a format that, or work with Kristen to get this in a format that can understand the projects that are already underway and the funding, and we'll get the color taken out of it and that kind of thing. And get that to you just as soon as possible. The CIP sheets, like I said, are already on the website, so you can take a peek at those. Those will be in the agenda item as well. But it would be my recommendation then that you would go back and kind of do your own calculations. And then the way that we did it during the meeting, I suggest we do it in a similar fashion where we'll have Kristen with the spreadsheet and you'll allocate a dollar amount and she'll tell you what's left. And we'll work through the project priorities like that.
It'd be almost like a workshop in a way, but, you know.
Well, we want to limit the April 1st meeting, because April 15th seems to be, we're going to have some other topics on there.
Yeah.
So,
When something could pop up between now and then as well, who knows?
yeah, but we're going to try and limit it, so this might be, it was an excellent idea that Melissa had to get this on as a preliminary discussion. And work through it. So now for April 1st, we'll be a little more prepared.
Yep.
Thank you.
Good discussion. Thank you very much. I appreciate it, everyone. Okay. We are done with our regular agenda. So recommendation from city officers. City manager.
No, because we've got some other things coming up in a little while. I have nothing else.
Okay. City attorney?
Well, I was going to wait until her 20th year service award, but I'll take this opportunity to let you know that McHale, as the city's paralegal, provides invaluable services to the city that may not be seen. I know you see what she does in connection with the work that you do with her, but she makes the operation of the legal department extremely efficient, and as a result, allows me to concentrate on the stuff that I need to do, which as a result, really results in a substantial savings to the city in terms of legal costs. And she really does a tremendous job, and I wanted to have an opportunity to recognize her for that. That's all I got.
Congratulations, Mikhail. I know you're here listening. Okay. City clerk.
Yes, just a couple of board items. Starting with announcement of vacancies, we have an unexpired term as an alternate on the Board of Zoning Appeals, an unexpired term on the Utility Advisory Board, and an expired term on the Building Board. And then under nominations, we do have an unexpired term on the Burnt Star Isles Canal Advisory Committee. We have 3 eligible applicants for nomination.
It looks like there's 4. Did one pull his name?
We
When's
have-
the resignation?
Randall Bodish resigned. We have Richard Dahl, Sean Harrigan, and Robert Samso.
And Mr. Harrigan. Oh, I'm sorry,
Yeah.
it's repeating, I'm sorry. I'm getting tired, can you tell? Sorry.
Understand.
Disregard.
So-
Nominate all.
Thank you. That's all I have.
Okay. Under policy and legislation, I think we've talked a lot about the topic of the day, so COVID-19. So we'll just, I know that we got lots of information from Florida League of Cities, and so it's just important to communicate as much as we can. The newspaper has offered up writing a column, just as something from, that the city could put out there just to kind of assure people. So I put together a draft, and Melissa's got the article, and she's going to be looking at it, and we're going to put this article out that's just kind of an op-ed piece on it to just give people confidence that we're really doing everything we can. So, and everything else has been canceled, so we have some nice.
Take this opportunity to read the 700 pages of things that are backlogged.
Exactly.
Let's start
Yeah.
on our end today.
Okay, John,
Nothing.
Debbie.
I want to congratulate Councilwoman Matthews, or Vice Mayor Matthews, pardon me, on the fabulous job she did collecting formals and tuxedos for the youth of our county.
Oh, my
It was
gosh.
Yes,
awesome.
congratulations.
Gosh, I just couldn't, I'm overwhelmed. It just was incredible.
Now, some of these gals, ladies and gentlemen, when they go to the prom, they're going to look like grandma and grandpa.
Oh, I don't know, some of those dresses were pretty nice.
Oh, I'm sure they are.
Charlotte Bridal gave me 84 gowns.
Wow.
She said, oh, I have a few dresses. And I said, okay, I'll come up and pick them up. They bring out this big rack. I'm like, oh my God.
Wow.
84, with all the tags still on them, every single one of them. They're beautiful dresses.
Wow.
But we collected over 400 dresses and probably over 100 suits and tuxes and all kinds of accessories and shoes and bags. And,
Wow,
I mean, just,
congratulations.
oh, it was great.
It's fabulous.
Thank you.
Good
You're
job.
welcome. You're welcome.
Thank you.
Congratulations.
So, Lynn?
Couple quick things. I mentioned we had done the tour. I went around with the guy from FDOT, who is L.K. Nandam's right-hand person, who runs the Fort Myers office. And I shared with him all of our issues at all of our little locations that we keep calling attention to at the MPO board meetings and otherwise. And he was able to at least see logistically what we're talking about with all these different situations that we're going through. I took him on the Over the River and Through the Woods Harborview Road tour, so he could see exactly how messed up the signage is coming southbound on 75. And he was like, huh, okay. And I think he was holding on for dear life because we're going down Harborview Road and you know how windy it is. But he understood, so at least tentatively, he was going to go back to FDOT and ask if they could at least put on the southbound sign next to exits rather than just getting people off at Harborview. So I'm hoping that that's going to happen. I'll find out. I have a conference call with Gary in the morning, so I'll find out if that's going to happen. But anyway, so we made a little bit of progress, and we talked about a lot of the different things that were in the original corridor vision plan. Second of all, as a board member of the Military Heritage Museum, I just want to let everybody know that the board met an emergency meeting on Monday night, and we are closing the museum as of tomorrow until at least the end of the month, and we will reevaluate. So please be advised that the museum is doing every abundance of caution measure to take, the risk out of anybody having to attend events at the museum, and also to protect our veteran volunteers who are all in the unfortunate age bracket that we're all being concerned about. Buckley's Pass the ribbon cutting's been postponed. Everybody knows that. We had a meeting, an organizational meeting last week, and because of all of this, we have postponed the ribbon cutting till sometime after May 15th. And last, I shared with Howard during the meeting that I got an email, and I think you probably all did too, of just this morning from Airport Authority, and they are going to be doing an emergency meeting that was unscheduled, but they're doing it by phone. And it's going to take place, looks like tomorrow? Oh, no, this
Well,
afternoon.
there's one at 1:00.
1:30 this afternoon, and they're asking that even the Airport Authority folks do the call-in option and not go physically to the meeting. So this may be something we should be taking a look at for future meetings, not knowing how long this is all going to last. So,
They're under the sunshine law,
Yeah.
and
Yeah, they are.
they're allowing calling.
yeah.
I don't advise them.
They're advised by,
Yeah, and our council member's only a liaison, so.
and they're advised by Daryl Carr, so.
Yes, I just wanted to share that I'll forward this to you. That's all I have.
Okay, Jaha?
Just basically, if everyone maybe can watch again the presentation with Dr. Pepe, just to be, so we're all on the speed with the same information. And also, just look to the city website for up-to-date information, and just, just be safe and be considerate to each other in this time. That's all.
Great, thank you. Citizens' comments on anything?
There are no citizens.
Seeing, citizens' comments. Okay, seeing no citizens here, meeting is adjourned. Thank you.